Savannah reminded me to record. I forget sometimes. Um, so some of these microorganisms are very virulent. In other words, they attack us with a pretty serious attack. COVID-19 is not the most serious attack out there. Yeah, it's killing people, but thank God that it's not killing people at the level of some of these other microorganisms out there. And again, every life is a loss. I don't like to when they report these things as numbers. You know, another 16 people died today, and we tend to lose sight of the fact that those were 16 people. So the coronavirus is killing people, but not at the level of some of these other things out there that could break out into our communities and kill us all. And by the way, most people believe that we will be destroyed eventually by a microorganism. Anybody who doesn't believe that is probably just not looking at the science, and they're not looking at history. So anyway, microorganisms, they get inside us and they destroy our tissues. They either live off of them or they use them to reproduce. Does anybody know, from just out of curiosity, does anybody know what it was that killed the Aztecs and the Mayans? It wasn't war. When they say that the conquistadors wiped out the Aztec civilization, what people tend to believe is that it was a war and they went in and killed all these people. No, they didn't. They actually came in and lived amongst the people, enough so that Spanish became their language. So, you know, the conquistadors lived amongst these people. So they didn't kill them. What did they do?
I believe I have the answer to that,
Go
Mr.
ahead.
Mahone.
Go ahead, Beth.
It was the fact that they compromised their water by disposing of their decomposing bodies into the area where they used to wash their clothes, drink their water, hunt, and it caused infection and caused a lot of death.
Okay. Again, that happened. I wouldn't doubt it, but it was also the common cold. You see, those people had no cold. They had no inbred disease or virus amongst their, or endemic disease or viruses amongst their population. And the common cold devastated their communities. And eventually, guys, it's going to be a microorganism that kills us all. Every major civilization out there that y'all have heard of that doesn't exist anymore came to an end, not because of war, but because of disease. The Roman Empire, nobody could beat the Roman Empire. They had their shit together, war-wise, but there got to be too many of them. And disease overran their communities. Not enough clean drinking water, and so on. And the Romans were experts at bringing water to the people. I don't know if y'all have ever seen the Roman viaducts built strictly to carry water from miles and miles away to the people. And it just got to be too many of them. And by the way, how many Chinese people are there today? 2 billion. It's too many of them. Even they recognize that. What do they do? Have y'all heard about limiting the amount of children a family can have and that type of stuff? That's happening for real. There are too many of them. So would it now surprise you to know that most viruses come from China? And you know, it's a political ploy. It's racist, if you ask me, or at least culturalist, for Donald Trump to continue to call this the China virus. Have y'all heard him do that? Oh yeah, this China virus. When the truth of the matter is, almost all viruses come from China. This is nothing new. So anyway, it's believed that these infections, these microorganisms getting inside us, something that is very difficult for us to protect ourselves against, are the things that will wipe us out eventually. All right. So let's now look at, that's what infections, and a little bit about what infections do to us and the two categories. So let's talk about outbreaks. You see, since we're always getting microorganisms inside us, why is it such a big deal now? Okay. Well, there are categories of microorganisms that live among us all the time. And not only do they all, do some of them make us sick, but some of them actually keep us from getting sick. So having microorganisms in the human body is not devastating. Do y'all know how much bacteria you carry around in your mouth all the time? A human bite is the nastiest of bites. I'd rather be bitten by a dog than a human. And that's why in daycares, we will not put up with biting. If your kid's biting somebody, they got to go home. It's nasty. Human bites will almost always become infected. Or the amount of bacteria that lives in your colon, and so on. These bacteria are healthy to us. So not all bacteria and parasites and that type of stuff out there is dangerous. Even some fungi are beneficial to us. And some parasites are beneficial to us. So all these microorganisms out there are not dangerous. They live amongst us all the time. What's dangerous is when something new comes in, something that our immune system is not trained to deal with. And as a result, we see things like coronavirus, COVID-19. All right, so it's not endemic to us. It's not supposed to be here in this location, in the United States or anywhere. It's not supposed to be amongst people. It hasn't been in the past. So endemic, these are infections that are expected to be seen in a population. And again, you'll see all these definitions in red. You'll see all of these on your upcoming tests. Okay. So endemic, infections that are expected to be seen in a population. If we don't see them, or if something comes in that doesn't belong here, yeah, it's going to raise some red flags for us. And we're going to start making some phone calls. And what I mean, calling the people who track this kind of stuff. So for example, the measles. The measles are endemic to the United States. Now, back in 2015, the CDC jumped the gun on that one. They published to the world, or to the country, that the measles is no longer endemic to the United States. They screwed the pooch on that one. And maybe a year later, what did we see? Outbreaks of measles happening on the East Coast and spreading across. And now they're tracking the number of cases. There have been 2,000 cases of measles. Why are they making such a big deal about that? Measles isn't killing anybody. They're making a big deal about it because the CDC said we no longer had measles in the United States. It wasn't endemic to us anymore. Another condition that was supposedly wiped out of the United States was smallpox. It's no longer endemic to the United States, but it still is endemic to Mexico. And give it some years, and the smallpox vaccine won't work for us anymore, because a new strand will move across into our environment, and smallpox will once again be endemic to the United States. Another infection you see on the screen is mononucleosis. We expect to see that here. We expect some girl from the high school to come over to the clinic and be diagnosed with mononucleosis. Doctor, oh, you got mono. Give you some medication, send you home. We're still going to report it because it's an infectious disease. We're going to give you some medications and send you home. No big deal there. We expect to see mono. It is endemic to our population. Mono is the kissing disease, mononucleosis. It's passed through saliva, and it's mostly girls. Boys don't get it as much, though they do. Most of the cases are going to be girls because y'all just out there kissing boys. And you know, girls got cooties already and boys don't. So that's why y'all get mono. Now, it's usually because mono is a very weak infection. All of you have had it. It's caused by the Epstein-Barr virus. You've all had it, but only certain people get sick from it. People who are immunocompromised, their immune system isn't strong enough to fight off the infection. And what can lead to immunocompromised menstruation? Stressing out about something. People in an immunocompromised position, and weak bacteria could make you sick during that time, like mono. So we don't get excited when we see a case of mono in San Antonio. It's endemic. It's supposed to be here. Okay? No sense setting off all the alarms and all that just for them to run down here and say, y'all know, don't worry about it. So it's endemic to the population.
Mr. Mahone.
Yes.
This mono is there like a cure for that or what?
Well, they're just going to give you some antibiotics to support your immune system while your body destroys it. It's all. It's not a lifelong thing. It doesn't affect other tissues in the body, anything like that. You may have to have your tonsils removed after a mono case, but nothing spectacular, no. It spreads by boys and girls kissing, or people kissing each other. So no, there is no. The cure is antibiotics and your immune system will take care of it for you. All right, I do need to stop for just a minute because I've got to send an email about who's here and who's not. So if I say your name a couple times, you need to speak up, let me know you're here. Can't see the screen real well because I'm using a laptop today, but I do see a lot of people. So Amaro, is that Roxanne? Give me a nod. Roxanne, Amaro, are you there? Give me a wave. I'm seeing Aramo, I'm sorry. No, this is Amaro, Roxanne. We have an Aramo too. So you guys,
I'm Roxanne Amaro.
There you are. Okay, I was looking at the wrong screen. Okay, I see Talisha Brooks, right? Yeah, there you are. What about Karanisha Butler? Butler. See, guys, this is why I need your whole name. Now, I'm looking at somebody on the screen named Amaro, and I don't have that on my list. I need y'all to go in and put your full name so that I can see it when I take roll. Okay. Angel, thank you. All right. And see, I have to, Angel, you're not even on my list. That's okay. I'll just write you in, but.
Excuse me, sir.
Yes.
You said you don't see my name on there, Amaro?
Yeah, I see you. You're here, yeah. But it was a different name. Okay. Jordan Carter, I know I saw you. There you are. Okay, I got you. Yardell is here. Renisha is here. Erica De La Rosa. Erica De La Rosa. Okay, I'm not seeing Erica. Jennifer Green, I see you. Davion is here. Jaime is here. Jasmine is here. Linda is here. Melissa is here. Okay. Where'd Melissa go? Oh, there you are. I see you. Vanessa Pargas, are you here? All right, Vanessa. Vidalia is here. Selena Puente. Selena, there you are. Angel Myra Riojas. I see you. Okay, got you. Alma Espinosa, I saw you earlier. There you are. I see you. I got you. Crystal Trevino. Where's Crystal? I got you. Savannah reminded me about recording. Thank you. And Dee Dee Wilson. Okay. I wasn't even going to try to pronounce your first name. All right. So anybody I did not call? Everybody looks familiar. I'm not seeing any names I didn't say. Okay, so let me go ahead and send this email. I usually type it up so that everybody can see it, so that you don't, I don't mark somebody absent by accident. So this is going to there and there and finish. All right. Today is the 17th. The people I have marked absent are Butler, Karanisha, De La Rosa, Erica, what just happened? Doggone it. Oh, come on. Really? All right, cool. So that's who I have marked absent today. Karanisha Butler, Erica De La Rosa, and Vanessa Pargas. Is there anybody whose name I did not call this morning? All right, going once, going twice, sent. All right, so that's taken care of. Okay, that's right, I got that. Okay. All right, so they do that, and then let's go ahead and take a break. Come back, it's 9:01, come back at quarter after.
Mom, can you do the play? Loud. My cat. Oh, hit him in his head. Hit him in the head. Hit him in the head. Just hit him in the head. What's the freak? What's the baby? What's the baby cat? Is it baby cat? Is it baby cat? Is it baby cat? Baby cat. Ew, he broke up. It's still leaking.
Your speaker's on.
No. You eat food too much. You eat food too much. Okay. You know what happened. You know what happened. You know what happened. 7, 1, and 2 was right. What? Wanna look at the cat look.
Somebody's microphone is
Hanging on the
on.
cat.
It's so annoying.
Look what happened. Look, he's gone. Ew. Like, what? 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 Talk to me. What? 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 What?
Jordan Carter, your mic, I believe, is on. Jordan,
What?
is that your mic that's on?
Say it again, I'm sorry.
Jordan, is that your mic that's on?
Yes, sorry, I didn't notice.
It's okay. It was really loud.
All right, I'm back. I'm not used to seeing y'all so small. All right, so the next definition we need to discuss then is what is an epidemic? Okay, guys, we talked about this last week. If you're gonna be in your car, turn your camera off. Again, I know people got things to do, but you cannot be in your car and attending class. I'm sorry, it's not safe. It's not safe.
You talking to me, Mr. Mahone?
Yeah, I see you in your car. Yeah, you gotta.
Yeah, I gotta go pick up my son's school stuff. I got a 7-year-old and I got a 4-year-old.
Okay, turn your.
So I gotta pick up their school stuff.
Okay, turn your camera off.
Okay.
Down on the seat or something where we can't see. All right. Okay. So epidemic. You see two definitions there for epidemic, and those are, and you need to know both of them. The first definition is a widespread outbreak of something that's endemic. Now, remember the term endemic, we expect to see it. But what if we saw 50 cases of mononucleosis from John Jay High School from one place? That would be considered an epidemic. Even though it's expected to be seen, we don't expect to see it like that, not in that big of an outbreak. So we would call that, even though mono is endemic, we would call it a mono epidemic. There are too many cases in one place. It's an epidemic. We had one recently in 2015 in California. Disneyland had 50 cases of measles break out amongst the guests in one weekend. So they called that a measles epidemic. Even though measles is endemic to the population, we don't expect to see it break out like that in one place. So a widespread outbreak of something that is endemic, or any outbreak of something that is not endemic, something that's not expected to be seen in the population, one case would qualify as an epidemic. For example, Ebola in the United States or anywhere in the United States would be called an epidemic, even though it's only one case. And there was a case of Ebola found in San Antonio back in it was the first time we were here, 1980. It was between 1986 and 89, somewhere back during that time. There was a case of Ebola at the up on 410 at the research center, 410 in military or something. Jaime, I just talked to somebody about being in the car. Okay, you don't have to turn your camera off. Okay. Jaime, can you hear me? Thank you. Guys,
Yes, I got my headphones on. I'm not driving.
Okay. I don't want to hear about y'all being in accidents and that kind of stuff out there. All right, it's not safe. All right, so anyway, any outbreak of something that is not endemic. By the way, I'll share something with y'all real quick. There was a teacher here who, when we first started the virtual classes, he was teaching his class while driving down the street. And notice I said, there was a teacher here. We're not having that mess. Are you kidding me? Anyway, so the two definitions of epidemic: a widespread outbreak of something that is endemic, or any outbreak of something that is not endemic. The first case of COVID-19 in the United States was an epidemic. Even though it was just one person, it wasn't expected to be seen here. So now a good question would be, well, do we consider COVID-19 endemic to our population now? Do we expect to see it here? Yes. COVID-19 has become endemic to us. So the best thing we can do now is find a vaccine. All right, y'all pay attention to that mute button. All right, so those are your first two. Endemic, something expected to be seen in a population. and epidemic, and its two definitions. And yes, Ebola can do that to you. So now y'all get an idea where the zombie movies come from. And that is a living person. That's not somebody that's dead. All right. The next definition we're going to talk about is pandemic. Now, pan means all. So this is an infection that is worldwide. And can anybody think of a pandemic right now? Yeah. Now, they're calling it a pandemic, but I don't know that it exists on every continent. But if it does, pandemic. Now, HIV is a pandemic. We know that HIV exists on every continent, no exceptions. So anyway, they're calling COVID-19 a pandemic. Why? Because it exists everywhere, a worldwide outbreak of a pathogen, a pandemic. And up until now, the best example of a pandemic that people knew about was HIV or AIDS. But I guess we could replace that with COVID-19 now. It's a pandemic, meaning all. It exists everywhere. That's a high miss question on the test too, by the way, and I don't know why. Worldwide outbreak of a pathogen, and somebody gets this one wrong. Worldwide pandemic. All right. The next definition is probably the most important of all of these. The word is pronounced nosocomial. Let me say it again, nosocomial. It means a healthcare acquired infection. This is something that the patient didn't have when they came in to see you, but after you treated them, they had an infection. That's nosocomial.
Like MRSA when it breaks out in the hospitals.
Like MRSA when it breaks out in the hospitals, exactly. So we're causing infection in people. Now, let me tell you now the second half of the IV man story. You know, I've been drawing blood for da. All right. Shortly after the young lady came out and started my IV, another young lady came in. Hi, Mr. Mahone, how are you? How you going? Yeah, what's going on? I need to swab your nose. Oh, why are you doing that? We're swabbing for MRSA. It's a hospital policy. We swab everybody that's admitted. You're swabbing the nose and running the test on every patient you admit to the hospital. What are you telling me right now? You're telling me there's a problem with MRSA in this hospital. If there wasn't, y'all wouldn't be going to this expense. You know how much it costs to do that? To test everybody that comes in that hospital for MRSA, and you wouldn't be doing it if there wasn't a problem with it in this hospital. Now, why is there a problem with it in this hospital? Because Wingnut won't put gloves on his damn hands. That's why. And why are they doing it? Because the infection control people at that hospital have identified MRSA as a problem there. And when they put that out to the people that work there, they all said what? Well, they must be coming in with it. So now they got to go through this expense and this amount of tracking to prove to these people in this damn hospital that y'all are causing MRSA in people. Y'all are spreading it between the patients because you won't put gloves on your hands. See, this is what I'm talking about. When homeboy said blood, I don't care about blood. I don't care. I don't give a damn if I get my blood on you. I don't want the MRSA that's under your nails to get on me or under that bandage you're wearing on your hand. I don't want that stuff on me. So it's not about protecting ourselves. It's about protecting our clients. Both. Well, actually, it's both. We do have to protect ourselves. I misspoke myself. But it's about protecting our clients as well. See, that's that problem. Have y'all heard of this stuff? And we'll be talking about it a little bit later. You know, I gotta use a whiteboard at least once today. I'm sorry. This stuff is all over the news today, isn't it? I should even just take it off my test. PPE. It means personal protective equipment. And there's a problem in that definition. The problem is this word right here. Now, back in the 1980s, when we started using this stuff, it was in place to protect us from what disease? Anybody know? What disease mandated PPE in healthcare? HIV. It was in place to protect us from contracting HIV. And you have too many people who either have been doing this shit too long, or they learn from somebody who's been doing this shit too long. And they get hung up on that word personal. This has evolved over the years into means of protecting our clients as well. So I don't care if you don't want to protect yourself, but you're going to protect me. And that's how I feel about people out there who refuse to wear masks. I don't give a damn if you don't care about you, but you're going to care about me, and you're going to wear a damn mask when you're around me. We had that in a meeting here once. I think I put some people off. We're right here in this room, and there are 5 or 6, there are about 20 of us in here for a teacher meeting. And there were 5 or 6 people who weren't wearing masks. And I just told them, I don't care whether you care about yourself or not, you can put a damn mask on around me. And people started pulling their masks up and all this mess. So anyway, people get carried away with the actual definition of the word PPE. Oh, it's to protect me. No, it's to protect everybody. And if you don't care about yourself, how the hell can I expect you to care about me? If that man doesn't care enough to wash his hands and protect himself from splashing blood or anything like that, how could I think about him protecting me? I know damn well you didn't wash your hands because you won't wear gloves. What makes you think you washed your hands? You're not protecting me. So that's why they were swabbing everybody's nose when they came in the hospital for that stuff right there, what this lady has in her face. Probably got it from an injection of Botox. I don't know, I just found the picture on the internet, but probably got an injection of Botox in her face. And they pushed the bacteria in with it. Later on, we'll see how much bacteria can fit on the tip of the needle. All right, so that's probably the most important word for us, y'all, and you know it's going to be on your test. A healthcare-acquired infection, nosocomial. They came in to see us. When we finished treating them, they had an infection that they didn't walk in with. And now, one more paragraph to this story, and then we'll be done with the story anyway. After I had my surgery, I'm up on the ward. My wife is standing there leaning against the window because there's no chair there. So she goes and she asks the guy comes in the room. She says, "Excuse me, can you get me a chair?" He said, "Yes, ma'am, no problem." And he left the room. He came back about 20 minutes later, pushing this really big, comfortable looking leather wheelchair, Here you go, Miss Mahone. Sorry it took me so long, but I had to get this out of an MRSA room and I had to clean it first. Are you kidding me? Why would you even say some silly shit like that to a client? I had to take this out of an infectious room and clean it before I could give it to you. My wife, who's a nurse, put her foot on the chair and pushed it across the room. So yeah, there's a problem with MRSA in that hospital because Wingnut refuses to wear gloves. All right, so nosocomial, healthcare-acquired infection. You came in to see us, we did our procedure on you, we caused an infection on you in the process. Okay, so that is the categories of breakouts in our communities. Those that are endemic, we expect to see them. Epidemic, new to our community, or widespread outbreak of something that is old to the community, or anything that's new. A pandemic is a worldwide outbreak of a microorganism. And nosocomial, a healthcare acquired infection. The most common nosocomial infections are urinary tract infections because of the amount of catheters we use in the hospitals. All right, so now let's start looking at the microorganisms themselves, the things that are getting in, making people sick. We use the word microorganism because they're microscopic and they're living organisms. So microscopic meaning that they're too small to see with the human eye. We need a microscope to see them. So I'm going to do a little something here. No, these ain't good. What the hell? Well, I just picked up a pair of scissors out of the thing over there and I just threw them back. Anyway. Shoot. I don't have anything else. This is what I usually do in the classroom. I ask you to imagine that this is a scalpel that we use to cut people for surgery. I just picked it up off the table over there. Can I do surgery on you with this scalpel? Why not?
Protected.
How do you know?
Because it's not sterile.
Okay, wait a minute.
That's still not cool.
Okay, can I do surgery now?
Mm-mm.
It's
Put all the
clean.
bacteria from your mouth on it.
But
Sure, for a lawsuit.
But I don't see anything on there. Come on, look close. Y'all see anything on there?
Mm-mm.
You didn't use your gloves.
There's nothing on it though, look.
It's still not sanitized.
Why
We
can't I
can't
use
see it.
the things we're concerned about, you can't see them with your eyes. So if you didn't prepare this for surgery yourself, you have to assume that it is dirty. I don't care how clean it looks. I didn't prepare it, therefore it's dirty. Now, or I don't have any assurance that it was prepared. Don't get me wrong, you won't prepare everything. Some things you'll pre-open the packaging. So what I'm saying is if I didn't open the package myself, if I didn't sterilize it myself, then I have to assume that it's dirty. One day in the emergency room, there was a guy setting up to do a suture, minor surgery, a wound repair, just a little cut on the kid's arm. And I walked past the room, just kind of glanced in there, and I saw the kid was sitting there, but then the parents were there, but the technician wasn't there. He was off doing something else. And there was a tray all set up with all the sterile instruments just laid out, ready to go. On the sterile drape, all set up like it was supposed to be. But I picked up the drape, rolled up all the equipment, threw the instruments in the dirty instrument bin, and walked out. About 5 minutes later, I hear somebody yelling in the hallway, "Who took my sterile field?" Sterile field is the area you set up with your sterile instruments. "Who took my sterile field?" So I walk out of my office and say, what are you yelling about? "Somebody went in there and they took up all my stuff. I was getting ready to use that." You were. Okay, well, here's what I want you to do. I want you to go find your trainer, have him come in and do that procedure. You come down to my damn office and talk to me. You don't even turn your back on a sterile field, let alone leave the damn room. Are you kidding me? "Well, I had to go down and draw up the anesthesia." I want you to tell me right now why you don't know that. Because if you don't know the basics, I gotta wonder what the hell else don't you know? You never turn your back on a sterile field. Once you open those instruments, they belong to you. You turn your back on them, there's no telling what could happen to them. Never turn your back on a sterile field. So unless you sterilized it yourself or you open the package yourself, you have to assume that that thing is dirty. And that's what I did. When I saw those instruments sitting there unattended, I had to assume that they were dirty. Otherwise, you cause one of them infections in your patients. All right, so microscopic, they're too small to be seen with the human eye. There are a couple categories of microscopes that you can use to see these things. The first one is called a light microscope. You probably have seen those. You see them in science classes. We have a couple here in our lab. And they're good to see bacteria. But if you want to see the smallest living organism out there, called a virus, you can't see them with those. You have to use an electron microscope, which are very expensive. So most of you will never come in contact with any type of electron microscopes unless you specialize in laboratory. Other than that, we use light microscopes. And again, we have some down there in the lab that y'all will be trained on. All right, so they're too small to be seen. Therefore, we have to assume that they are there. This is the tip of a needle under an electron microscope. And that's bacteria on the tip of that needle. And that's 150,000 bacteria on the tip of the needle. So that's what you're pushing into the person's skin when your needle is dirty or when you don't cleanse their skin properly. Now, you can even see on here that the tip of the needle looks rounded. Why? Because it's so small, you can't even see the tip. So to us, it looks pointed. The tip actually disappears to us. But you see, you get down there small enough, and yeah, you see a rounded end. And also, look at all these imperfections in the needle itself. See, these are not bacteria. These are imperfections in the tip of the needle. But to us, that thing looks as smooth as glass. But you see, there are imperfections in there. They're too small to be seen. And then all the bacteria. And I don't know what this green stuff is right there. I have no idea what that is. Stuff right there. I don't know what that stuff is. But all the rest of it, that's all that bacteria on the tip of that needle. So anyway, they're too small for us to see them with our eyes. So we have to assume that they're there. All right. So let's, before we get into the stuff that's dangerous, let's talk about that stuff that I mentioned that is not dangerous to us. We call it normal flora. Normal, it's supposed to be there. And flora is growth. Like a florist grows flowers. Normal flora. As a matter of fact, if this stuff is not there, you might get sick. An example is that we have approximately 300 different bacteria that live in our colon. Now, I'm not talking about 300 bacteria. I'm talking about 300 types of bacteria. There are billions of bacteria living in your colon right now. And you know what they do? They keep you from getting sick. The other day, we're in the car and my wife reached in for, this was just what, Saturday. My wife reached in and pulled out her lip gloss, her chapstick. And she said, yeah, the corners of my mouth or I got cracks in the corners of my mouth. And she said, I must be deficient on something. Yes, you are. Vitamin K. Vitamin K is produced by the bacteria that lives in your colon. And if you don't have enough of it, it's important in our blood clotting. If you don't have enough of it, classic sign is you develop cracks in the corners of your mouth. So I told her you need to go over to Walmart and get you a this encourages the growth of normal flora in us. And to get back to producing that vitamin K for you. And that's the symbiotic relationship. Symbiosis, they do something for us, we do something for them in return. We give them a place to live and to grow and nutrients. What they provide for us is, one, they protect us from invasion.
Giving Kyrie number so they could call this.
They keep. All right, y'all. Really? Guys, the cars are not going to cut it. I'm sorry. If you're in your car, turn off your camera. Talisha, did you have a question?
No, sir.
Okay, you got your hand up.
Oh, I'm sorry.
Y'all know you can do that. You can put your hand up like that, ask a question.
Yeah, I just learned that this morning.
Oh, okay. All right. Well, play around with it. That's, we expect that in the first couple of days. All right. So anyway, what was that? Oh, okay. So the bacteria that lives in our colon, we've already said that they produce vitamin K for us. I'm sorry, y'all. I'm using a different version of PowerPoint here on this laptop, and the pen and the PowerPoint just aren't playing well together. But anyway, they protect us by preventing other bacteria from moving in. And they benefit us by producing us with vitamin K, or producing vitamin K for us. So that's the symbiosis. We give them something, they give us something in return. So not all bacteria is bad for us. Now, what do you think would happen if we destroyed the normal flora that lives in your colon? What do you think would happen to you? If we destroyed the flora that lives in your colon?
We would become ill.
We would become sick. Remember, they protect us. So other bacteria would move in and make you sick. The stuff that the main bacteria that lives in our colon is called Clostridium. And if we destroy that, then a new Clostridium will move in. And you will have a different Clostridium, or Clostridium difficile, also called C. diff, if you've ever heard of that before. It usually happens to people after we treat them with antibiotics. The doctors are so aggressive in the antibiotic treatment that the antibiotics we give them actually destroy their normal flora as well. And new bacteria starts moving in. You have Clostridium difficile, or C. diff. So we don't want to destroy that flora that lives in your colon. It's going to make you sick if we do. That stuff helps to protect you. So that's normal flora. It's supposed to be there, and without it, you get sick. And there's a probiotic, and there's C. diff, Clostridium difficile. We destroy the good bacteria, this bad stuff moves in. And probiotics can help to keep that from happening to you. So what do you think doctors out there do if they treat a patient with antibiotics that destroys their normal flora? How do you think? And they start getting this other bacteria in them. And now they've developed C. diff. And how do you think the doctor treats that? This is how twisted our world is. They give them more antibiotics. Really? It's the overuse of antibiotics that got me in this situation in the first place. Now you're going to tell me that to get me out of this situation, you're going to give me another antibiotic. It's crazy out there, y'all. And the reason is we have doctors coming out of medical school today with the idea that we have a pill for everything. If you get sick, take this pill. How long have we been that way in our world? In the United States, anyway. Oh, since about the 1980s. See, what did they do before then? How many of y'all were born before the 80s? Yeah. Okay. When you got sick, what'd your mama do? Chicken noodle soup, 7-Up, get your ass in the bed. How many times were you dragged off to the hospital because you had a runny nose? 0. Give you a hot toddy. Y'all remember those? Brandy and honey. Good. Now go to bed, boy. All right. Parents got you drunk and put you in the bed. Okay. Today, got to run you off to the emergency room. Got to get you some antibiotics. Guys, I don't ever remember going to the hospital as a kid, except whenever I cracked my damn head open and needed sutures. Other than that, we didn't go to no damn hospital. Mama had a cure for everything. And we grew up just fine, didn't we? When you had ADD back then, my dad said, I got the cure for ADD. It's called an ass whooping. Today, we got to put you on drugs. Have you drooling because you're on freaking drugs. So today, drug commercials outnumber car commercials and beer commercials combined. That's a damn shame. Oh, we got a pill for everything. Can't get erection? We got a pill for that. Oh, you're depressed? Here, we have a pill for that too. Not saying that some of these pills aren't effective, but we just get carried away with it. We got a pill for everything. And here's how bad it gets. I had severe, I have depression, happens occasionally, not all the time, but I was really down this time. And the doc says, well, I'm gonna go on and put you on this depression med called Wellbutrin. So I went on and took the Wellbutrin, okay? And Wellbutrin caused erectile dysfunction. So I'm looking at my wife, babe, I'm depressed and can't even like get laid now. So I go and talk to the doc. Doc, the Wellbutrin causes erectile dysfunction. Well, here, just take one of these. He gives me a prescription for Viagra. So now I'm taking the depression med plus the Viagra. The Viagra gave me a headache. So I said, hey, doc, the Viagra gives me a headache. Oh, if you get a headache, we'll just take a couple of these. Stop, okay? I came in here for depression, and now I'm on 3 different meds. The depression med, the erectile dysfunction med, the headache med. And that's how they tend to do. Oh, if this causes you upset stomach, here, take one of those. That'll take care of that. How about I just don't take the damn depression med? How about that? And learn to deal with it. So that's where we are with medications today, y'all. We got a pill for everything. And if you're not careful, they're going to load your ass up with them and send you home with 5 or 6 different pills you're taking every day. What is that going to do to us as humans as we progress thousands of years into the future? We're changing the chemical makeup of the human body by sticking all these damn chemicals in everybody. And then take stuff you don't even need. Oh yeah, take these probiotics, they'll help you. They got people taking probiotics on a regular basis. And so on when you don't need the stuff. Multivitamins and ... So anyway, that is where we're headed with the pills, guys. We got a pill for everything. Me, I try to avoid as many medications as possible. Take only what I think I need. And those are the things for my heart. All right, we won't use this word anymore in the lesson. It's pronounced antigen. It is a word that we use in the world, but not as part of what we're talking about. Antigen is any microorganism that gets inside us that's not supposed to be there. Most microorganisms we encounter don't make us sick. Those are antigens. They're just like free radicals. They float around in us. They're not harming us, but they're not doing anything for us either. They're antigens. We're going to focus instead on this term, pathogen. The word part patho means disease. So these are microorganisms that can cause disease in people. They are pathogens. When we refer to something as being pathogenic, it's something that makes people sick, are pathogens. So patho means disease, and know that pathogen is a microorganism that's capable of causing disease in people. The one you're seeing on the picture there is called Clostridium tetani. It's the bacteria that causes tetanus in people. And this is an artist's rendition of tetanus from back during whatever time, in about 1500s or something. And it is an exaggeration. But tetanus does cause all the muscles to fire like that. And they will be arched in the bed, but just so like their butt is off the bed. And their heels in the bed and their shoulders and heels making contact with the bed. Everything else arced up like that. This is a little bit of exaggeration. You see the grimace on the person's face. That's because the muscles of the face are contracted as well. So this is what happens to you if you step on that rusty nail. Y'all heard of that before? And you haven't had your tetanus vaccine and you don't go treated for it. You could end up like that laying in the bed with all your muscles contracted. So that's an example of a pathogen, a disease that can, or a microorganism that can make us sick. Now, tetanus was a problem in the United States back in the 1920s and 30s. And a whole invention came out of it. Tetanus was primarily happening to women. So what is it that women were doing back in the 1920s and 30s that men traditionally didn't do? Of course, it's different today, but back in those days, men didn't do a whole lot of this. And it doesn't have anything to do with menstruation or anything like that. So what is it that women did that men traditionally didn't do back in the 1920s and 30s that was causing tetanus in these women? Any ideas?
Cook and clean.
It had to do with cooking. Okay. Back in the day, before, remember that little device that you squeeze down on the canned goods and you turn it like this? And it opens the canned good all the way around. Okay. Before then, you use what was called a church key. It's that little pointed thing you put on the edge and you do like this. And you go all the way around. And you end up with this little star-shaped looking thing, man, that was sharp and would cut like glass or cut like a razor blade. And women were cutting themselves on the canned goods using those stupid things. My wife still can't open canned goods today, y'all. And we got the electric thing. And she's like, babe, come open these canned goods. And I'm like, babe, really? You can't use a can? Of just do it. So I just open the damn canned goods for her. Now, how many of y'all clean your canned goods before you open them? Those things have been sitting on trucks, trains, ships, airplanes, warehouses with cockroaches, rats, bats shitting on them, cockroach pee, and all this mess just all over the place. And you pop it open, and when you go with that little thing, go all the way around, and you get it cut, and then the lid falls down in the food. And then you pull it out. Mm-hmm. How many wash your soda cans before you drink out of them? Yeah. My wife did. My wife doesn't even drink out of them. She'll either pour it in a cup or she'll put a straw in the can, but she won't put a soda can up to her mouth. I wash them because I'm just too lazy to da-da-da. But anyway, women were opening canned goods and cutting themselves on the sharp lids, not going to the hospital and ending up with tetanus. Today we have the tetanus vaccine. You get a good cut though. We're gonna. They ask you, so when was your last tetanus vaccine? Oh, I had one 2 years ago. Okay, we're gonna give you another one today. So that 10 years, nobody sticks to that. I know they say the vaccine is good for 10 years, but you
Work in healthcare, they give you a tetanus shot too.
Yeah, you go into healthcare or you go into the hospital or ER with a good cut, we're gonna give you another tetanus shot today, regardless of when your last one was. Because tetanus is one of those bacteria that can be destroyed post-exposure. In other words, you don't really need a tetanus shot until you're exposed to tetanus, and it'll still work. So yeah, we're gonna give you a tetanus shot today, just because we don't want you to end up like that. All right, so the types of pathogens we're gonna be discussing and the categories that they come in. And the first one being a bacteria. Now, everybody heard of this stuff before because it's everywhere. We can control viruses a hell of a lot better than we can control bacteria, because bacteria are everywhere. Now, bacteria grow best in a warm environment. So the warmer the place, the better the bacteria will grow and proliferate or spread. And bacteria are classified by their shapes. Now, since bacteria grow best in a warm environment, what's that telling? What answer is, or what question does that answer for you about clinics and hospitals?
That's why it's always cold in there.
It's always so damn cold. Why is it so cold in here? There you go. Bacteria grow best in warm places. So we're going to keep it cold. Oh man, how y'all doing? All right, good to see y'all too. Students at the door just got to show their face. Like I remember who they are. And I won't remember y'all either. So when you see me say, hey, Mr. Mahone, it's your Dell. Remember, I go, hey, how you doing? I won't remember your freaking name. You know how many Roxannes and Savannahs and Angels and Jennifers I have in my doggone classes. Anyway, hey, how y'all doing? All right, so anyway, bacteria grow best in warm environments. Therefore, it does us benefit to keep our hospitals and clinics cold. It discourages the growth of bacteria. All right, so bacteria can be classified by their shapes. In other words, we have to see them under a microscope in order to say what bacteria that is. And it's important to know that because different treatments for different bacteria. So the first shape we're going to start with are the round bacteria. You may have heard this word part before. Coccus or cocci, if you've ever heard of Streptococcus. So you see that some bacteria will have their shape included in the name of the bacteria. Streptococcus, telling you right there, it's a round bacteria. Coccus. All right. Now there's more than one round bacteria out there. Like you may have heard of Staphylococcus. We shorten that up and call it staph. So Streptococcus and Staphylococcus are both round. Then how do we tell the difference between the two? By their arrangement. You see that Streptococcus arranges itself in these chains like this. They just line up, one attached to the next one, and they end up making a long chain of them. When we see a round bacteria lined up in a straight line like that, or in a line like that, we know the bacteria we're looking at is Streptococcus. So when bacteria have similar shapes, then we can further classify them by their arrangement. How are they arranged in relation to each other? Round bacteria that are lined up in a chain, Streptococcus. As opposed to this one, a round bacteria that's clustered together like that, like a cluster of grapes. If they're clustered together, we call them Staphylococcus. So that's one of the reasons we need to look at bacteria under a microscope. We can tell the difference between different ones based on their shapes and on their arrangements. So a round bacteria is a coccus, and all the bacterial shapes will be on your test. Round bacteria is called a coccus. The next shape is a rod shaped. You see, it's a little bit different. It's not round, it's just elongated like that, like a capsule or a pill, if you will. When we see a rod shaped bacteria like that, it's called a bacillus. Now, the tetanus bacteria is a bacillus, but we call it Clostridium tetani. It doesn't have the word bacillus in its name. Some do, some don't. Another rod-shaped bacteria is one called Bacillus infernus. It has the shape as part of its name, but they don't always have that. So a bacillus is a rod-shaped bacteria, causing conditions like tetanus in people. The next shape is a spiral shape, like a spring. Turn my pen on. I just like drawing, so I know y'all see it. I'm gonna draw it anyway. Called a spirillum or spirochete, either one of these two names. Spirillum or spirochete, both mean spiral. Now, the spiral bacteria have caused conditions like Rocky Mountain spotted fever, Lyme disease. Both you get from deer ticks. And I'm going to go on and mention where some of these supposedly new stuff we've never seen before, where's this stuff coming from? For example, COVID-19, where did it come from? And how did it get into the human population? Everybody has their theories. But one way that microorganisms get into the human population is by cohabitating with other animals, animals that we typically don't live around. Right back here in this neighborhood behind the school, there's some really big houses back there, you know, $1 million houses type thing. And that's where I drive around. When I go on break, I get in my car, I drive, I smoke cigarettes. I don't like just sitting in the damn car like that. So while I do my drives, I notice there are a lot of deer back there. And some of them are pretty big. The other day I saw a buck back there had to have 8 points. I mean, this thing was huge. But they're living back there in a residential area. And deer carry deer ticks. Deer ticks spread Lyme disease and Rocky Mountain spotted fever. So now you have somebody who's running the risk of contracting Lyme disease just by being in their own backyard. Because we're cohabitating with these other animals like that. Now those deer are back there because they can't get out of that little neighborhood back there, because around them is Wurzbach, and the other side is Highway 10, and then Callahan's over here and Fredericksburg's over there. So they can't get out across those streets, so they're trapped back there. Somebody needs to call the stupid city and have them moved out of there. But what you got is you got idiots living back there going, oh, look, we have deer on our land. And they're feeding them and this type of stuff. And then wonder why your kid ends up with Lyme disease just by playing in your own backyard. So half of the infections that we get from these microorganisms are coming from other animals, because we're living with those animals now. How many of y'all know that it is not, as far as the health department is concerned, it is not acceptable to have chickens in your yard in a residential neighborhood, or ducks, or even rabbits? Did y'all know that?
Well, I know you can't have ducks, but I have chickens. They just told me to get rid of my ducks.
They let you keep the chickens?
Yeah.
Oh, okay. Well, that's probably why we keep hearing that damn rooster in our neighborhood over there. Oh, I'm like, really? Damn. I thought chickens too, but ducks, okay. I definitely knew about ducks. Why did I know? Because we had to get rid of our ducks. When our kids were little, they were all into animals and stuff. So we had a couple ducks in the backyard, and the city came by and told us you can't have ducks in a residential neighborhood. And later on, I'll tell you why. Because there's a good reason for it. Us cohabitating with these other animals like that. So spiral bacteria are known as spirillum or spirochetes. They also cause conditions like genital warts. So people often mistake warts as being caused by fungus, but actually there are bacteria, viruses, and fungi that actually cause warts on people. Later on, we'll be seeing an example of a virus that causes warts on people. But this is a bacteria that can actually cause genital warts in folks. Okay, it's a spiral bacteria. The last bacterial shape is called comma shaped. Shaped like a comma, from writing. Now these bacteria are called vibrios. Vibrio. And again, for your testing, know which bacteria and be able to match it to its name. The comma shaped are called vibrio. And they've been responsible for a condition that has caused a lot of suffering in the United States over the years. That condition is called cholera. And y'all might remember from your history classes if you paid attention, or just know that there have been a few cholera outbreaks in the United States over the past few years. In 1911, cholera killed 752 people in San Francisco. And in 1932, it killed 2% of the population of New York City. Now, what is it about these two cities, San Francisco and New York, that drove these cholera outbreaks there? What is it that these two cities have in common?
Overpopulation.
Overpopulation, yes, they're both crowded. Anything else? Okay.
They're both not very clean.
Yeah, they're both
Near the water.
Yes. Immigration. Now, don't get me wrong. I'm not saying that immigrants came to San Francisco and New York and they brought cholera with them. That's not what happened. During the 1911, there was a large influx of immigrants from the Pacific. They came primarily from China and Japan. And as a result, Chinatown sprung up in San Francisco. I was stationed about 45 minutes from San Francisco during my first assignment in the Air Force, and my wife is from that area. So we did several trips down to San Francisco, just sightseeing and that type of stuff. And she had some friends that lived there and so on. And they took me to Chinatown. Chinatown is filthy, y'all. It is dirty. I couldn't believe, I'm walking around going, this is a national or worldwide tourist destination, Chinatown, and it's just a dirty place. But anyway, now in 1932, it wasn't Asian immigration. It was German, French, Italian, Irish, all coming from Europe. Now, the problem in San Francisco or in New York was that they came in through a place called Ellis Island, and they had hospitals on Ellis Island. They still do. Now they're in a tourist attraction. But they had hospitals to screen out all the immigrants that were coming from Europe that were sick, and they weren't allowed to go into the city. They had to stay on Ellis Island. But if they weren't sick, that's the issue. There was no control. These folks were put on a ferry. They went right into New York City, got off the ferry, and just boom. There was no control over where they went or were allowed to go. And as a result, they sprung up with an area in New York City that's called 5 Points. 3 sections all come together in a point like that. It's also called Hell's Kitchen. And what you had was German, Italian, Irish, French. Everybody had their own little section. And these places were jam-packed with people. If you came to the United States with your wife and 3 kids, you went to live with your brother and his wife and their 4 kids in probably a 2-bedroom apartment. All those people living together in one place. The same thing happened in China, in Chinatown. Now, they're doing a census right now. Okay? How do they know how often to pick up the trash in your neighborhood? What do they base that on? Right now, they do the brown can once a week. They do the blue and the green can once a week. How do they know that that's enough? And what do they base it on?
The population, the amount of people within the household and the area.
Yes. And here's what happens when you don't do your census. My sister-in-law was a census taker back when they just walked house to house. You couldn't do it online back then. And she told me that when they come to a house, they knock on the door, nobody answers, they'll come back one more time in a couple of days. Knock on the door, nobody answers, they write down 4. Saying that 4 people live in this house. And that's what they base the trash collection on, a population of, or a dwelling population of 4. Anybody ever live in a house with more than 4 people living there? What was the trash like? You always had more than what fit in the can. So that's what was happening in New York. Too many people living together. The trash wasn't being picked up. And when you have trash, what do you have that goes along with it? Rats, roaches, flies, mosquitoes, all carrying infection. When it rained, all that trash got washed down into the water table. And they were all drinking contaminated water. That's where cholera comes from. Their water wasn't clean. So if you're old enough to remember 1984, I think it was, they called it the Mariel boat lift, when Castro opened the doors of Cuba and let anybody who wanted to leave. And they all settled and they all came up to Florida, and they were put in these little camps rather than let go into the city. And people just thought that was a horrible way to treat them. But the truth is, they were trying to avoid what happened in New York City. And they didn't. No matter how much they tried, all those folks still settled in one part. And right now they call it Little Havana. So that's what's going to happen with any type of mass immigration. A lot of people living together is going to breed disease within those areas. All right, so that's why cholera killed so many people back in those days, because of the immigration. All right. Or everybody living together. Let me rephrase that. So those are your 4 shapes of bacteria. The round bacteria called coccus. The rod-shaped bacteria called bacillus. Spiral-shaped bacteria are spirillums and spiral sheets. And the comma-shaped bacteria is called a vibrio. So we classify bacteria based on their shapes and then their arrangements. What shape is it and how is it arranged when we look at it? There are 2 more categories to classify bacteria. And there's your first one, gram-positive or gram-negative. Now, what we're saying there is we're taking a type of stain called a gram stain. And we're putting that stain on the bacteria. That's what the dropper and the slides are all about. You smear the bacteria on the slide, you take the dropper and you drop a drop of purple stain on that slide right on top of the bacteria. And the bacteria absorbs the stain, it's gram positive. If it doesn't absorb the stain, it's gram negative. Now, that started as a way for us just to see them better, because bacteria are difficult to see on a microscope slide. But if you stain them and they absorb the purple, they stand right out and you can see them really well. So it started as a way for us just to be able to see the bacteria. But over time and through some experimentation and use, they found that bacteria that didn't stain purple also tend to be more resistant to antibiotics. So then it became a treatment purpose for us. For example, if the lab calls back and tells your doctor, Doc, the bacteria you sent me is a gram positive strep bacteria. Oh, it absorbed the stain. But what if it's a gram negative strep bacteria? The doctor may need to be more aggressive with the antibiotic therapy. So we want to know whether bacteria absorb stain or not. Look at it this way. The bacterial membrane, if it won't absorb the stain, then it probably won't absorb the antibiotics either. It has a more resilient cell membrane. So if you tell me that the bacteria that our patient has is gram negative, I may need to bombard that thing with antibiotics before they finally get through. Okay. So we use it as a treatment connotation as well. Now, whether it is gram negative or gram positive. And then the bacteria are classified based on whether they are aerobic or anaerobic. Aerobic means that they grow best in oxygen. And anaerobic means they grow best in the absence of oxygen. AN means without, like in anemia. Anaerobic, without oxygen. So these grow best in the absence of oxygen. Why is that important to know? Because a bacteria is not always from the place where we find it. For example, if we find a bacteria in your mouth, did that come from the mouth or did it come from your stomach? A way we can figure it out is test it to see if it is aerobic or anaerobic. If it's aerobic, it came from the mouth, a lot of oxygen in the mouth. But if it came from the stomach, it's probably anaerobic bacteria. So if we test the bacteria in your mouth and find that it's anaerobic, it probably didn't come from your mouth. It probably came from somewhere else, like your stomach. So knowing the aerobic status of a bacteria can help us decide where in the body that bacteria originated. In your colon, we're going to find anaerobic bacteria. In your nose, we're going to find aerobic bacteria. If we ever find anaerobic bacteria in your nose, it came from someplace else in your body. So we can use the gram status to determine how aggressive we need to be with the antibiotic treatments. And we can use the aerobic status to determine where in the body the bacteria is actually coming from. Just because it's in your mouth doesn't mean it's coming from your mouth. It might be coming up from your stomach. All right. So we classify bacteria on their shapes, their arrangements, their gram status, and their aerobic status. All right. So where is bacteria going to grow best? Either in us or in a room. It's going to grow best where these 5 things are available. We've already mentioned that bacteria grows best in a warm environment. You take that warm area and you add moisture, darkness, and nutrients. All this bacteria is going to grow pretty well. Can you name a place in your body that has warmth, moisture, darkness, and nutrients? That's why we have so much bacteria in our mouth, in our armpits, in the growing area, in your nose. All 5 of those things are there. And in there is going to be oxygen. In your stomach, lack of oxygen. But if you provide these things, the bacteria will grow and spread. So now you know why bacteria grows pretty much everywhere. In the wintertime, bacteria doesn't grow as well, but it still grows. Now, it's not saying that it has to be like absolutely warm for any bacteria to grow, but the warmer it is, the more bacteria will grow. So even on a cold tabletop, you'll find some bacteria, but you will find most on a warm surface, like the human body. Now, why do we need to know what makes bacteria grow? Why is that important to us? Because sometimes we're going to grow the bacteria ourselves. Why would I want to grow bacteria someplace? So that I can take it, put it under a microscope, and see what it is. If I want to know what bacteria is growing out of your mouth, you see, I just can't take that swab out of your mouth, put it on a microscope and look at it. Because believe it or not, that bacteria will be so congested, you won't be able to see it. Remember how much bacteria I said is in the mouth? You take a swab of somebody's nose, you put that on a microscope slide, when you look at the microscope, you're gonna see something like this. It's just too much there. You can't see shapes, you can't see arrangements, all you can see is a blob like that. It's just too much freaking bacteria in one place. So what we're gonna do is we're gonna take that swab, which is called a culture. You can culture anything. Just take a sterile swab and rub it on that thing. If you wanna culture a laptop, culture somebody's nose with the COVID-19, that's what they're culturing. That's what they're doing at the test sites. They're taking the nasal swab and they are swabbing the nose. They're doing a culture, a nasal culture. Has anybody ever had a throat culture? They reach in with the swab and they swab your throat. A vaginal culture, a rectal culture, a wound culture, a cut in your arm, they just run the swab through that cut. If you want to see a lot of good bacteria grow, culture your cell phones and see how much bacteria grows on them bad boys. All right. So what are we going to do with that once we culture it? Take a sterile swab and just rub it on the thing. Or if you want to get like really technical, you can take it and roll it through the thing. Whatever it is you're trying to get a sample of, whether it's their throat or a cell phone. Just, and now that sterile swab has bacteria on it. We're going to take that swab now, since the bacteria is there, we want to provide the 5 things that makes bacteria grow. And the first is the nutrient. The nutrient is on the dish already. Now, y'all may have heard of these little lab dishes being called a Petri dish. But when it has a nutrient on it like that, you can just barely see it. That's why it looks shadowed like that. When it has a nutrient on it already, we call it a agar dish, a Petri dish that has nutrients on it. So this dish comes with the nutrients. That's the first thing. Then we're going to take the swab that we took and we're going to roll it into the nutrient over to one side like this. And this culture looks like that on purpose. It's done absolutely the way it's supposed to be. You just roll it back and forth in there, in that one spot. Now, if we try to grow bacteria and then take a sample from here and put it on the microscope, we won't be able to see it. So we need to thin this out. We're going to throw our swab away. We're going to get a new sterile swab. We're going to start up here and start rolling some of this stuff down that way. Throw that one away, get a new one, and start rolling it out this way. And keep doing that. Go in there with something like that. Take a final swab, start over here, and drag some of this out onto a tail like that. And when we want to look at this under the microscope, we're going to take the sample from out here on the tail. When we put that on a microscope slide, that's when we'll see the shapes and so on. So you see from the picture that the swab or the congestion is getting less and less through each step. So that by the time we're out here, we can put that on and see what shape it is and all that. So that's what we're doing when we do a bacterial culture. Just get a swab of it from that person, put it on a agar dish like this. So the nutrients are there. Now we need to provide the warmth. So we're going to put this in an incubator. It's going to warm it up. When this dish starts to warm up, condensation is going to build on the dish. And that gives us moisture. The natural condensation that'll come from just heating this up. So we have nutrients, we have warmth, we have moisture. The last thing we need to provide is darkness. Close the incubator door and let it sit in there for 24 to 48 hours. Come back and it's going to look like this. See, when you first did this, you just rolled the stuff in there, but you weren't seeing any of this. You just rolled the stuff in there. This is what it's going to look like when you take it out 24 hours to 48 hours later. Then you can go there and grab some bacteria off of there. So we're going to provide the things that our bacteria needs to grow, the nutrients on the dish, the warmth from the incubator, the darkness from the incubator, the moisture is going to come from condensation. And boom. Now we can take that out in 24 to 48 hours and see what actually grew on there. And then call the doctor back and say, yes, Doc so-and-so, this is Mr. Mahone from the laboratory. We have the patient of the lab results for Miss Jones. Her culture showed that she has a gram-positive bacteria that is a strep. And that gives the doctor the direction to go with the treatment. How do you treat a strep bacteria? All right, so that's called a culture. When we are taking a sample of a bacteria and growing it to see what we need or what it is. So have those 5 things: warmth, moisture, darkness, nutrients, oxygen, and lack of. I won't ask you to list these out, but a sample test question would be, which of the following is not one of the 5 things that bacteria needs to grow? And you pick out what doesn't belong. All right. Now we can go a little bit further with our culture. If the doctor says, well, Mahone, send this down to the lab and get a culture and sensitivity test. So that's the first part, the culture. So what is a sensitivity test? We're going to get a separate Petri dish or agar dish, and we're going to completely fill the dish with the bacteria. We're not going to use a pattern. We're just going to roll this stuff in there completely on that dish. And then we're going to take these little tablets. These are little pieces of cardboard or little pieces of paper, and they have antibiotics soaked onto them. And each one of these is a different antibiotic. So in the place where you do your lab samples, this will sit up on the shelf, kind of like a spice rack. And you just go down the line, dropping one of each onto your plate. And then put it in an incubator. And we'll come back in a couple days and we'll find that some of that stuff is growing right over that antibiotic that we put on there, which means that is not effective against this bacteria. We're looking for stuff that has a large halo, but also pay attention to the halo. Look at this one over here. You see how sharp that line is as opposed to this one? So even though this one has a bigger halo, this is the one I want to use, this one or this one right here. See how sharp that line is? That bacteria has said, oh, never mind, we're stopping right here. This stuff has moved up and stopped, but then has started to move forward again. That's why the line is fuzzy. This bacteria is mutating to that antibiotic. This one over here, I don't want nothing to do with that stuff. I'm stopping right here. I am not going any closer. So that is what antibiotic we want to treat that person with. And that's called a sensitivity test. Which antibiotic is that microorganism sensitive to? This stuff right here eats that stuff up. Right here, same thing. Over here, I'm gonna stay away from that. It's sensitive to that bacteria. So now we can tell the doctor, hey doc, yeah, listen, that sample you sent me, it's a gram-positive strep bacteria that's sensitive to LLIN, that's sensitive to amoxicillin. So now the doctor knows which antibiotic to treat you with. And that's the culture and sensitivity test. We're going to grow it to see what it is. We're going to submit it to or expose it to antibiotics to see what it's sensitive to. So now we can call the doctor on the phone, tell him what it is and which antibiotic to treat the patient with. Methicillin, amoxicillin, ampicillin, whatever. So that's the sensitivity part. So let's take a break. When we come back, we'll talk a little bit about what antibiotics are and why we use them. It is 10:35. Let's come back at 5 minutes till 11. Give us a 20-minute break. Get up, get some circulation to your butt, splash some water on your face. Do like I do, go outside, get some fresh air.
What time did you say to come back?
Five minutes till.
Yes, no, mute.
North
All right. So my wife took my car this morning. I just came out, my car was gone, left me with her car. And she keeps an air freshener in there that's like really, really strong. And that stuff gets into my taste buds, man. This is horrible, y'all. I got this chemical taste in my mouth. I'm gonna tell her about tomorrow. I'll be taking my car, man. Because she don't want to drive her little car. But anyway, we talked about antibiotics is where we kind of left off. And antibiotics are highly effective against bacteria. In order to explain that, let me show you what an antibiotic does. Okay, this out the way. Okay, this will represent a microorganism that gets in your body. We call it or we'll call this one a bacteria. All right, now what antibiotics do is they don't destroy this bacteria. What they do is they coat it so that it can't reproduce or it can't do anything. So it can't eat your cells for a living. Therefore, being coated like that, the bacteria eventually dies. It's like a person who can't get food or water. They're going to die eventually. So that bacteria will die just in a couple of days if it can't get anything to live on. So that's what antibiotics do. They coat the bacteria so that it dies. And they're highly effective against bacteria. However, we'll call this one a virus. Now, viruses do different than bacteria. And that is, in order for a virus to reproduce, it has to invade your cells to do so. Another example over here. Does this look familiar to y'all, this line right there? Does that look familiar to y'all? This is what the interior of the virus looks like. Just a little line in there, like that. But what if I did this? Now, does it look familiar to you? It might look like that twisted line. I did this. Now what is it? Now what does it look like? A DNA strand. Okay, so the virus has the blue part. Where does it get the green part from? From inside your cell. So that virus needs to invade this cell. Once it does that, it drops off its strand. And now you have viral DNA. And this cell will now start to produce copies of the virus. So that's how viruses reproduce. They've got to get into your cell in order to do that. And that's how they destroy the cell, by reproducing inside it. Now, an antibiotic will do the same thing as this over here. It will coat that virus so that it can't invade a cell. However, those viruses that have already invaded the cell, antibiotics won't work on those. So this right here has to be destroyed by your own cells that show up to destroy it. The virus will destroy, the antibiotics will stop it out here. But once it gets inside, you have to rely on your immune system to come along and eventually destroy that cell so that it stops making copies of the virus. It's the way we in the military will execute a traitor. They can't be trusted now. They're with the enemy. So this virus, once it gets inside, this cell is now with the enemy. So our only option is to send our cells over to kill it. And that's what's happening in people's lungs with the coronavirus. They breathe in the virus invades their cells, their immune system comes over and destroys those cells, and by doing so, is destroying their lung tissue. It's the only way we have to destroy infected cells or to handle infected cells. There's no healing them. We have to destroy them. And right now, people are getting holes poked in their lungs because their immune system is destroying all of these cells in there. Think of your lungs like a brick wall, or the walls of your lungs like a brick wall. Each one of the bricks being a lung cell. And when they start to get infected with virus, your immune system shows up and destroys all of those cells or bricks. And what's left now? They've got all these holes in their lungs. And that's what's happening with the coronavirus getting into people's lungs. The flu does the same thing. It's just that the coronavirus is a more aggressive virus. All right, so that's what that slide means when it says that antibiotics are highly effective against bacteria, but only somewhat effective against viruses. That's only half the battle. The antibiotics will take care of the virus itself, but the infected cells have to be taken care of by your own immune cells. The antibiotics won't work on those. So that's what that slide means. Highly effective against bacteria, but they're only somewhat effective against viruses. All right. Now, how long, does anybody know how long we've been using antibiotics in the world? Started in the United States, by the way. How long have we been using antibiotics in the world? I want to guess what year? Okay. Antibiotics were discovered in, okay. I'll stop that. 1925. And they were discovered by accident. It wasn't in a medical laboratory, it was in a science laboratory where somebody took a dish that had been inoculated with a bacteria. And back then they just smeared the whole dish. And they put that in an incubator. And when they came back after a couple of days, what they saw was bacterial growth on one full side of the plate. The other side, nothing, no growth at all. Person thought, wait a minute, I put the smear on the entire dish. Because remember, you can't see this when you're doing it. You're just rolling it on there. It's gonna look the same when you get done. After a couple days is when you see the bacteria on there. So this person's like, wait a minute, I know I did the entire dish. Why is there only bacteria growing on one side of it? So this person took the dish and turned it around in the incubator. When he came back, there was no growth on the plate at all. What the hell? He started looking at other stuff in the incubator. See, this was 1925. They didn't have the rules we had today. Somebody had a paper bag in that incubator with their lunch in there. You would never do that today. But an incubator would be a good place to keep your lunch warm. So there was a paper bag sitting right here. And the dude looked in the paper bag, and in the bag was a sandwich that had, I'm just having fun right now, that had mold growing on it. Now, see, somebody like me, I'd have probably started cussing and screaming, threw everything away and started over again. But this dude was smart enough to go, wait a minute. Let me take some of that and put it in the middle of a bacteria slide like that. And what did he have when he came back? That. The bacteria or the mold right there, and nothing growing around it. And this person was smart enough to say, wait a minute, I've discovered something that kills bacteria, but not the host. Hey, can we put this in people and it destroy the bacteria inside them? Sure we can. And we'll call it against life, antibiotic against life. So we discovered the first antibiotics in 1925 by accident because somebody put a moldy sandwich in an incubator. And that's what antibiotics are. They live on, a mold lives on bacteria, and it won't hurt us, or most of them. So the first antibiotic was prescribed to patients in 1944. And does anybody know what disease the first antibiotic was used to treat and totally get rid of it? 1944, right after World War II.
Influenza?
Good guess.
Was it a type of STD?
Syphilis, you're saying? Yeah.
Syphilis.
Syphilis.
The first antibiotic was called penicillin, and it was used to destroy syphilis, 1944. So that's the history of the first prescription of antibiotics to people, was to get rid of syphilis. Now, this is going to sound off the subject, but not. Does anybody know what this is? The Rosetta Stone. Does anybody know what that is? All right. The Rosetta Stone is a stone tablet. I know y'all have heard of it, like the language teaching program, Rosetta Stone. You can learn any language by listening to a tape of somebody else speaking it. Anyway, how dumb is that? Anyway, the Rosetta Stone, what is it? Okay, it is a stone tablet. Back in the day in 1935, when Howard Carter discovered the tomb of King Tut and all these other Egyptian monuments and stuff, they had that writing on there. Today we call it hieroglyphics. Back before then, before this, they didn't know that that was a language. They thought it was just decorations. But then they found the Rosetta Stone. It was a stone that had a translation of the hieroglyphics into Greek. And since people still speak Greek, they're able to translate it now into languages of all types, all languages. So the Rosetta Stone was the key to translating hieroglyphics. Before they found this, they didn't even know that that was a language. They just thought it was decorations. So then they got really excited. And those big obelisks and pyramids and all that, they wanted to go and translate all that stuff that was on there. Who built this and who built that and who was Seti the first and who gave a damn. What they didn't pay attention to was all these little jars that they had, hundreds of them, and they were all filled with papyrus, paper. And nobody got excited about those. We'll translate those later. Let's find out who built this and who built that. And they translated all the useless shit. The good stuff was in these jars. And they're just getting around to some of these. And they're finding some pretty cool stuff. For example, there is an Egyptian papyrus from more than 3,000 years ago that says, if a person gets sick, have them eat moldy bread. What is penicillin? Mold. Our ancestors weren't stupid. They were using antibiotics 3,000 years ago. And we discovered them by accident. They probably did too, but they knew that mold destroyed bacteria. They may not even have known that. They knew that mold could cure you of certain disease, and the people were having bacterial infections. So that is infection prevention, preventing infections, or infection control. Now, how do they prevent infections? In that same jar, they found another papyrus, probably some medical guy's jar. They found another papyrus that says if somebody gets a bad cut, cover it with honey. And we know that bacteria cannot move through honey. So if you got a cut on your arm, they covered that cut with honey so that the cut wouldn't get infected. They may not even have known why, but they were using infection control and prevention 3,000 years ago. And we're just catching up today. So our ancestors weren't stupid. They could figure shit out just like we do. And we're supposed to have the thousands of years of experience and computers to help us. And we still took an accident to discover antibiotics. Now, 1944, we started prescribing antibiotics to people. And what have we done to ourselves? See, antibiotics were the wonder drug. Doctors just started handing them out like they were free. And guess what? Today, they're losing their effectiveness. We're seeing too many conditions now that are resistant to antibiotic treatment. Methicillin-resistant Staphylococcus aureus, or y'all have heard of it as MRSA or MRSA. Multi-drug resistant tuberculosis, multi-drug resistant gonorrhea. There's a multi-drug resistant syphilis. There are 27 conditions that have antibiotic resistance. And we've only been using them for, it's been about 95 years now. And we're just about to the point where they won't work anymore. What are we going to do if we reach a point that antibiotics don't work anymore? Diseases like gonorrhea, syphilis, will start killing people again. So what we're saying is stop handing out the damn antibiotics like that. If you go to a doctor with a UTI, that doctor's going to put you on antibiotics. But what do we know works for UTIs? Y'all know it.
Cranberry juice?
Cranberry juice. We know it works. But if you go to a doctor today with a UTI, they're going to put you on antibiotics. That's what we're saying. Stop using the damn antibiotics so much and start relying on some of those things we already know works. Staph infection or staph bacteria is destroyed on contact with oregano. We know that. We've seen it in laboratories. So if you have a toothache, or if you have an infected tooth, what do you do for it? Put oregano on your food, and within a few days, that infection will be gone. It takes antibiotics 10 days. But with oregano, that's the spice, y'all know the stuff. Just a couple days, it'll be gone. We know that works. But instead, if you go to the doctor with an infected tooth, what are they going to do? Put you on antibiotics. We're overusing the antibiotics. The WHO, not the rock band. You got to be kind of old to know who the WHO is. But anyway, I'm aging myself, I guess. This is not the rock band. This is the WHO, the World Health Organization. Okay. Now, the World Health Organization meets twice a year in Geneva, Switzerland. And they are the #1 doctors or the top doctors from all over the world. Did y'all hear that your president pulled the United States out of the World Health Organization? That's okay. As soon as he loses this next election, we'll be right back in again. In other words, telling the top doctors in the United States, you cannot go to these 2 meetings every year, is what he's telling them. But anyway, they meet twice a year, and they're the top doctors from whatever countries they come from all over the world. You have to be invited to join. You just can't show up. All right. In 2015, they had a meeting. And at the end of that meeting, they came out with this statement. The world is headed into a post-antibiotic age in which diseases that have been treatable for decades can once again become untreatable. We're using up the antibiotics, y'all. The microorganisms are mutating, and these antibiotics are not effective as they used to be. Back in 1960s, you got a shot of whatever, what did we use? Oh shoot. I believe it was ampicillin, but don't quote me on that. You got a shot of ampicillin and it destroyed your gonorrhea. Today, it might take 2 doses. We're using these things up. And how are we using them up? And I don't mean we're running out of supply. I mean, they are not effective anymore. Excuse me. Has anybody ever seen a MMA fight? Okay. Now compare an MMA fight to a boxing match. You know, Muhammad Ali type of boxing match. Okay. How many of y'all have had antibiotics before? Okay. Now, some antibiotics you take with food, some antibiotics you take on an empty stomach, some you take in the morning, some you take in the evening, some you avoid sunlight while you're on them. They all have all these different directions. But there's one direction that's true for all antibiotics. And it should have been the thing that they spoke to you for at least 4 or 5 minutes about. Anybody know what that is? It's true to all antibiotics. And it's the most important instruction they gave you, if they even gave it to you.
Take it from 7 to 10 days.
Take it for the full 10 days. Don't stop early. Even if you start feeling better, continue to take these pills every day. Why is that so important? Okay, back to the boxing match. In a boxing match where you're fighting for, a world heavyweight champion and if one of the opponents gets knocked down, the referee jumps in immediately. Stop. You go to a corner over there, and I'm going to stand here and count to 10 and give this person a chance to get up and continue to fight. Do they do that in an MMA match? When you hit the ground, they ground and pound. They jump on you and they continue to hit until you quit. That's why they call it tap out. Okay. When you stop taking your antibiotics early, what has happened to you is the bacteria has been beaten down to a point where it's not making you sick right now, but it's not gone. It's still there. It's laying on the mat, waiting for a count of 10. You stop. There you go. But not only does it come back, but when you knock that dude down, he saw the punch that knocked him down. And when he gets back up, guess what he's going to do? He's going to avoid that punch again. he's going to change the way he fights. The bacteria will mutate and become resistant to the antibiotic that knocked it down in the first place. That's where antibiotic resistant diseases come from. Somebody or people out there who didn't take the antibiotics the way they were prescribed. They stopped early. And that's why you can't get antibiotics over the counter, by the way, because nobody would take them correctly. And even with them being prescribed, and even with the instructions we give you, people are not taking them correctly. And as a result, we're seeing all these multi-drug resistant conditions pop up. And when we say multi-drug resistant, we're talking about only antibiotics. So they need to call them what they are. Antibiotic resistant drugs or microorganisms, not multi-drug resistant. They're antibiotic resistant. They don't respond to antibiotics anymore. So that's where they come from. So as a result, we need to get away from these just handing antibiotics to people. Remember what we said, we are a drug environment today. You go in and see your doctor, it's about volume business today. And more doctors practice law than practice medicine. In other words, they do only what they know will keep them out of trouble. And then do that for 20 years and retire to Florida. So what happened to the days of the house call? Knowing your clients. Hell, there was a place down here on Fredericksburg, y'all. I didn't know, or Babcock. I didn't know, it wasn't a place, it was a billboard. And I didn't know what that billboard meant. It was a guy, a little cartoon character, male, standing up, and he's pulling what looks like his underwear out in front and looking down. And I looked at that a couple times driving through, like, what the hell is that? And finally, one day I got stopped at that stoplight and I was able to read the little caption underneath. This is a place that says, take a picture of it and send it to us. And we'll diagnose you and treat you like that. The guy was literally had his phone out, supposedly taking a picture of his genitals. So he can send that to the doctor so the doctor could diagnose him and prescribe him based on the picture that he sent. That's medicine today. The day of knowing how your clients live, visiting your clients at home, those days are gone. It's all about volume business. Get them in, get them out, get paid. So anyway, that's the World Health Organization. We're using up the antibiotics. We need to come up with other treatments that we know work. We mentioned one last module, peeing on your feet. When we talk about foot fungus, yeah, pee on your feet. It'll destroy the fungus. But instead, you rush off to the doctor and get you some Lotrimin to rub on your feet. So anyway, that is bacterias. Before we go into the next microorganism, let's recap. Bacteria themselves. Done all of that. This is where we want to be. Bacteria grow best in warm environments, and they're classified by their shapes. Know the shapes. Coccus are round. Bacillus is rod. Spiral sheets are spiral. And Vibrios are comma-shaped. We also classify bacteria on their gram status and their aerobic status. The 5 things bacteria needs to grow, and then why we grow it. We talked about the antibiotic resistant bacteria out there. Remember, this is just a sampling. There are 27 conditions identified so far that have grown resistant to antibiotics. And the one, you know what, I do want to talk for another minute about this. Methicillin resistant Staphylococcus aureus. What does that mean? This person has a staph infection that's resistant to methicillin. Methicillin resistant. Why is that important? Because the standard of care for a staph infection today is methicillin. If you go into the doctor and the doctor diagnoses you or looks at you and what they're looking at, they think it's a staph infection, they'll put you on methicillin and send you home. Now you're at home taking that drug for 7 days and realize you're not getting any better. As a matter of fact, you're getting worse. So you go back to the hospital. Hey, doc, that stuff you gave me, it's not working. Oh, you must have the MRSA version. So now you're so far into that infection, we got to admit you to the hospital and treat you with what?
Antibiotics.
Antibiotics. And they're going to put you on an antibiotic cocktail, which is where you're receiving more than one antibiotic at a time. Okay, so now we got you in the hospital. We got you on the antibiotic cocktail. And guess what's going to happen to you now? C. diff. Remember that? Destroys the normal flora. We've got you on so many antibiotics, it destroys your normal flora. Now you have C. diff. How could all of that have been avoided in the first place? By doing the culture and sensitivity. If they'd have done that, one of those tablets they put in there is methicillin. And they'd have found that shit growing all over methicillin. And they'd call the doc back, hey doc, yeah, you got an MRSA on your hands. They'd have treated you with a different antibiotic and none of that other stuff would have ever happened. So that's laziness in doctors. They want to get you in, get you paid, get you out. Or get you in, get you out, and get paid. So they look at you, looks like a staph infection, go and give them methicillin. Next patient, and it's 7 days before they realize it's an MRSA, as opposed to a basic staph infection. All right, and then we talked about the World Health Organization and what those people are recommending as far as antibiotics go. So our second microorganism we're going to talk about then are viruses. And you see here, check this out. Viruses grow best in a cold environment. Completely opposite bacteria. So why we get the damn hospitals cold then? Because remember, bacteria are on everything. We can control the spread of viruses in different ways. You're not going to protect yourself from a bacteria by wearing a mask, I promise you that. So, and remember the virus has to get inside you. So it's got to go in some way. That's how we protect ourselves. We cover the entries. And now you know why we should be wearing masks. It not only protects the virus from getting in you, it also protects the virus that you breathe out from getting out there into the air. It restricts the flow of the virus. It doesn't travel near as far. Now I can get through the mask, and don't forget, don't believe that either. When you put a mask on, when you're breathing out, that virus is coming out that mask, but it's only coming out like that far, not 6 feet, like if you weren't wearing a mask. So viruses grow best in cold environments. And since their sizes or their shapes are just too numerous, we would have thousands of names if we tried to name viruses based on their shapes. And this shape right here, that is the Ebola virus. So how do we classify them then? Since there are just too many shapes, we classify them on how they're spread. Viruses are either airborne, they spread through the air, you breathe it out, somebody else breathes it in. Or they're bloodborne. They pass from the blood of one person to the blood of another person. You eat them or swallow them, drinking. Or they're sexually transmitted. Now remember that just because a virus is sexually transmitted doesn't mean it infects the sexual tract. HIV can be passed through sex, but it's actually a bloodborne pathogen because blood happens during sex. And when the blood is present, the blood can move, or the virus can move from the blood of one person to the blood of the next one while having sex. It doesn't infect the sexual tract like gonorrhea, syphilis, chlamydia. Those infect trichomoniasis or trichomonas. Those infect the sexual tract. HIV gets into the bloodstream while having sex. All right. And that's how they are spread. Now, an airborne virus can float on air currents. And what makes a virus airborne and others not? HIV is not an airborne virus. Lucky for us. Matter of fact, was that last module Alan came to class and talked to us about HIV? Yardell, were y'all there for that? Guy came in from the San Antonio AIDS Foundation. Okay, we'll try to get him back this module since we are talking about HIV and all that stuff. We'll be talking about those things pretty deeply tomorrow. So yeah, I'll call Alan today and see if he can come back in and talk to us. All right, so the HIV virus. If you were to cut yourself and bleed it out onto a table, the virus would live for about 3 seconds. Isn't that good news? Yeah. Once the virus leaves your body, its life expectancy is less than 5 seconds. Yeah, hey. However, in the hub of a needle, remember it's still protected in there. So as long as it's inside the needle, the virus will live. And that's how you get it from sharing needles. The virus is inside the needle. It hasn't come out, went straight from your arm into the needle. And as long as it's in there, it's still living. But if you cut yourself and the blood drops out on the table, about 5 seconds before it dies. Vidalia, where you at? Question?
Does that mean that the HIV is neutralized or, I guess, killed off through oxygen? Is that what the percentage of oxygen exposure in the needle?
Right. No, because the needle hub, so y'all have to remember that even though the needle is open to the air, that tube down the middle is so tight. And if it's filled with blood, then the needle, the blood on the surface will be affected by the oxygen. But this stuff all down here, oxygen never gets to it. Okay, you kind of see what I'm saying? If that's the needle that's filled with blood, this stuff up here is exposed to the air and it will die. But this stuff down there is still well inside the needle. So it hasn't been exposed to the air. So I don't know if, I really don't know the chemistry behind it. And those numbers I get from the San Antonio AIDS Foundation, that the HIV will only live in the air for less than 5 seconds or outside the body for less than 5 seconds. Okay. So, and we'll have a class on HIV tomorrow. So the cold environment allows the virus to turn into a spore. So if you have a living virus that's out there ready to go, man, and you cough this stuff out and it hits the air, the cold air is going to cause it to freeze. And now it floats on the air currents until somebody else breathes it in. And now the spore turns back into the virus. And this is what COVID-19 is doing, moving from one person to the other. Now, the good thing about the COVID-19 is that the heavier this virus, the less distance it'll travel. And COVID-19 must be a pretty heavy virus because it only travels 6 feet. Now, the flu virus, that stuff can float on air currents for hours and greater distance. So that's where they come up with the 6 feet. The virus is so heavy that even when you cough it out, it'll travel out about 6 feet before, boom, it drops to the ground. So that's why the 6 feet. Good thing it's not like a flu virus that can just float around the room. If you cough out the flu in this classroom this morning, then when they come in for the evening class, it could still be floating around here and somebody breathe it in. So that is your virus and how they move around through the air. Now we can control them by airflow. For example, a negative flow. What that means is that the vents don't blow air into the room, they suck air out of the room. So that if you cough out a virus in that room, the virus gets sucked up into the air conditioning, rather than somebody opening the door and the virus floating out the door. In a negative flow room, that actually creates the air from the hallway to be sucked into the room, picking up the virus and then up through the air conditioner. So that's negative flow, and that's how we can control viruses. So if you have an airborne virus in the hospital, we're going to put you in a negative flow room so that the air gets sucked out of the room. And then we'll follow our precautions. And PCTs, where y'all at? Raise your hands. You'll be more involved in this type of stuff. You walk up to the patient's room, you put on your mask, you knock on the door, and you wait for them. And they will let you know when it's okay. When is it okay? When they've put their mask on. So you'll knock the door, just a minute. They'll put their mask on, they'll say, okay, and then you walk in the room. So we use negative flow and we use our procedures to help protect us against airborne viruses. So therefore, our hospitals are kept cold to keep down the growth of bacteria. We use other ways to protect ourselves from the viruses. And that's one of the issues now. The first thing they said when they started talking about the COVID-19 way back in April, they're like COVID this and COVID that. And my wife and I are sitting in the living room watching the TV. And I turned to my wife and I said, good thing summertime's coming. Viruses don't spread as well in the summer. I said, good thing summertime's coming up. And we wasted it. We wasted this summer. And what do I mean by that? This was the time that we should have been locked down, doors closed, in the house watching freaking TV. And people blew it. They opened the restaurants. Of course, you're going to see a decrease in the summertime. They open the restaurants. They're opening schools. So now, the best time to stop a virus would have been the summertime. Now we're headed into the worst time.
What is wrong with this thing?
Is the winter. And that's another reason that San Antonio is not near as bad for the outbreak as some of the other places, because it's been hot. It's been 105 freaking degrees. It's hot. Go to places, see, if y'all have never lived outside San Antonio, see, in places like Missouri, New York, Chicago, it gets down to about 7 degrees in the evening. Early evening, like 6 or 7 o'clock in the evening, the temperature is dropping. Here in San Antonio at 6 o'clock, the temperature is still plateaued at 105 degrees. That's good for us. As it gets cold, this virus is going to start spreading further than 6 feet, because it'll come out, turn into a spore, and then it can float. And that's going to be a problem for us. So is this over with? No. We're headed into the worst time, the cold season, the flu season. And that's why, by the way, you get colds and flus when? During the winter time. It has nothing to do with your body being cold. Remember Mama told you that? You better zip up your jacket, you're going to get a cold. Wouldn't you like to be able to go back to those days and say, no, Mama, that's not how you get colds. You don't get colds because you're not wearing a jacket. You don't get colds because your hair is wet. You get colds in the winter time because they float better and farther when it's cold outside. So you get colds because it's cold outside, not because you're cold. I would love to just go back and have that conversation with my mom. All them damn time. Boy, yeah, it's gonna catch a cold, gonna catch the double pneumonia, and da, 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 da. That's not how it works. They spread better in the winter time because it's cold outside, and viruses spread better in the cold. All right, and then bloodborne, we protect ourselves by covering up cuts, not coming in contact with other people's blood, and using our barriers, gloves, face shield if you think the blood's gonna splash. Food and waterborne, we cook our foods to the appropriate temperatures. And then sexually transmitted, hey, know who you getting with. Look at stuff, turn them lights on and look for a minute. I'm serious. How you doing, guy? Let's turn on the lights for a minute. We will turn on the lights for, because I want to see everything first. You go climbing into stuff you ain't even looked at yet. You gotta be, you see what's happening down here. Anyway, so looking for little sores and all that kind of stuff. Anyway, so that is, where's my mouse? There you go, viruses. All right. They require a living host to reproduce. We've already mentioned that. The virus must get inside the cell, and that's the RNA part. That little strand, that little wiggly strand by itself is RNA. When you put two of them together, there's DNA. So the virus brings its own, then hijacks yours to create viral DNA out of it. So that's an RNA virus. Now, viruses are genetically specific. What that means is that if you have a human that gets a dog virus, the attachment points, they won't line up. And you don't have an effective DNA strand because the dog's DNA is different. You see how the attachment points don't line up? These two could never merge together. That's genetic immunity. The DNA is different. So you can't get the same virus that a dog can get, or that a cat can get. Now, there are some viruses that get into our respiratory tract. Those are the ones that can be shared between animals. But remember, they've talked about, oh, this cat tested positive for COVID. This dog tested positive for COVID. But they never said that the dog or cat was sick because the attachment points don't line up. Can they have the COVID in their lungs? Yes. But the attachment points don't line up. So it can't infect their cells. All right.
Erica, they pass it on then?
Yes, as far as I know, yeah. I mean, if they breathe it out, then yeah, they'll breathe it out of their lungs. So if anything, that's what they're saying. But the cat or dog is not sick from it because it's a virus. The attachment points have to line up as far as the DNA goes. All right. So that's why they were yelling about bird flu not too long ago, some years back, about swine flu some years back. These are animals that can carry the virus that's infectious to humans, but it's not infectious to them. It doesn't make them sick. So they're carrying a human virus inside them, even though it's not making them sick. All right. Probably the most dangerous virus to us as humans is this one right here, influenza. And people tend to say, well, you know, people get the flu all the time and live. That's because the right flu hasn't come along yet. But it will. The flu that's going to come is going to be the one that they have already nicknamed the super flu, the one that kills us all. It's coming. In your lifetime, maybe not. In my lifetime, hopefully not. But eventually, there will be a flu that will kill us all. There were some good candidates over the years. In 1918, along came the Spanish flu. And this is that picture I was telling y'all about. 1918. Look familiar? People walking around with masks on. So, and this was the police department. Now, if you know, everybody else was asked to wear masks as well. So anyway, that is nothing new to us, even in the United States. There have been times where it's happened before. The Spanish flu killed 1% of the world's population. What's that sounding like? They're still looking at the numbers every day. Numbers going up about 1,000, what was it? Something like, hell, it's 1,000 a day in Texas. About 200 a day in Bexar County. So what's the growing number across the world? They estimate it's about 10,000 new cases every day. How long is it going to take before that number reaches 1% of the world's population?
But sir, back then they didn't travel as much. So how was it spreading? It was more just in big cities? Like now we have cars, buses, and planes. They didn't have much of all of that like that. They had boats and stuff, but they weren't like going everywhere like we do.
Renisha, excuse my language, but you are the man. Nobody's ever asked that question. I usually have to bring that up. How did it spread all over the damn world when they didn't have airplanes? And you see what's happening today. The airplanes are pretty much shut down. Hell, man, you can fly from here to California for $5, yo. They're so desperate for money, it's ridiculous. And guess what? You're not getting my ass on one of them damn things. A closed environment with anybody in there possibly sick, and you're all going to be sick when you get off. You're not getting me on one of those damn things. I don't care what you're charging. But my wife's like, oh, look, we can fly to California for $60. I'm like, so shit, I'll drive, man. Sorry. Anyway, so that is a very good point. I always make that point during class. Thank you for making it for me this time. Yes, we fly, and they didn't. Are y'all familiar with the commuter jets? These people who work in San Francisco but live in Los Angeles. Or they work in Boston but they live in New York. These people literally get up in the morning, drive to the airport, get on an airplane, fly to another city, work there all day, and fly back in the evening. It's quite common today. There are people who fly from Europe, from the United States to Europe twice a week on business. I sat on an airplane next to a guy from Japan. We were flying to Hawaii. And for some reason, he had to take his flight from Japan to the United States and then to Hawaii. I don't know why, but that was the route that he was flying on. And he was going to Hawaii to play golf. That day, he was flying back that evening. That's how we fly around the world today. And look at what we're carrying with us. So if something like as virulent or as aggressive as the Spanish flu was to break out today, it'd be a hell of a lot more than 1%. And the difference between this and coronavirus is that this stuff was killing people in 72 hours. From their first cough, 3 days later, they're dead. And it did not kill just the old people. See, when the flu virus, we expect the very old and the very young to die from this stuff. But this killed people in here in 3 days. That sound familiar to y'all? You see, back in April, if you asked anybody about COVID, they would say something like this. Until young people started doing what? Going to the beach because I'm not old. Did y'all see any of that in the news? Do y'all watch the news? Y'all see any of that in the news? That pool party where they had almost 300 or 400 people in one swimming pool. the beach gatherings, the concerts, and they're all what? Young people, middle-aged people. And guess who's dying today from COVID? 19, 20-year-olds. The highest rate of infection, not deaths, but the highest rate of infections is amongst 19 and 20-year-olds. And back in April, I was telling my wife, look at these fools. Now, see, if you don't give a damn about yourself, what about your grandmama? You can carry that shit home to your grandparents, to your parents, and kill them. And never know you did it because you don't know how this shit works. Because somebody else told you, oh, it don't get young people like us. And you listen to that shit rather than going and checking the news and seeing what it really does. And if you really want to know how dangerous the COVID-19 is, do not listen to your president. Do not listen. That man, I don't know what his problem is. Do not listen to him. He doesn't know what he's talking about. And he proves that on a daily basis. So anyway, the Spanish flu, if it breaks out today, y'all, what are we gonna do? Except die. So what do we do today, my wife and I? We go out early in the morning. If we go to the mall that day, we are there when they unlock the door. And we'll walk around until it starts to look like, oh, got too many people showing up, babe, let's go. But you can get an hour or two walk around the mall in relative safety. But when it seems like people are just getting too close, getting a little bit too many people, we leave. We also go to places like Tanger Outlet, where you can walk around outside and you can decide which store you want to go into and we go to the flea market, and we usually go to the one up on 410, the Traders Village. Why? Wide open aisles. Those other ones, like the Bussey's Flea Market out on 35, those aisles are just too tight, man. I mean, you cannot stay away from people walking through there. So we're avoiding that one right now. The Poteet Flea Market is not too bad. You can move around, but the widest areas are over there at the Traders Village. So we think about things. We still do restaurants, but we do takeout. So it's easy to protect yourself, guys, if you just give it a little bit of thought. My wife is kind of thoughtless when we walk around the flea market, though. She'll be walking around and somebody won't have a mask on, and she'll just walk like right past them. Me, shit, I go this way. I move way over. If you're not gonna wear a damn mask, all right, 6 feet then. And I'll move the hell away from you. There's one lady got an attitude with us the other day at the flea market because my wife was standing there looking at a plant, and this lady walks over unmasked, and she walks real near my wife. I said, babe, move away from that lady. She's not wearing a mask. She gave me a dirty look, but I wish she would have said something. I might have to drop the B word on her. Biatch. I know you not. Anyway. So, guys, you got to be diligent. And my wife, sometimes she's just not diligent enough. Because, see, she's like a shopper. And she gets out and, man, if she says, ooh, look, da, 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 da. I'm like, babe, stay away from these people, man. They're not wearing masks. So I get to be the bad guy. I've said that a few times. You know, there's a good thing stupidity isn't contagious, or we'd all be stupid. All right, so anyway, that's the flu virus. And, guys, it is dangerous to us. Where do flus come from? Okay. And this is where there's some truth behind what Trump and the other people of that administration are saying. However, they're doing it the wrong way. They're using it as a whatever kind of tool for them. Why does this take? I hate this laptop, yo. I need to get back home on my computer. It just takes too long. But anyway, is anybody familiar? Has anybody ever heard of the island of Hong Kong? Okay. I mean, you know your world history or your world geography. Did you know Hong Kong is an island? And whose TV is that we're hearing in the background? Check the mute button. Did you know Hong Kong was an island, the most populated island on the planet? In one area, about the size of New York State, 35 million people, all living on one island. And that place has more 100-story apartment buildings than any place else in the world. Have y'all even seen a 100-story apartment building? So since they can't grow out, they have to grow up. So their buildings are, it's crazy to see this island. As a matter of fact, let me try something here. Really? How the hell did that happen? God, I hate this. I hate Bing, y'all. I really do. Hong Kong, and it shows you 1,000 pictures of what does he say about Hong Kong, probably. Look at this place. All these people congested together. Okay. So that's Hong Kong Island. In the background, China. Where do most flus come from? China. Now, they believe that the coronavirus came from Wuhan province of China, which is right outside the Guangdong province of China, where all flus originate. They all come from here. And see, if they cross that harbor into Hong Kong, look at what they got. 35 million people. They got boats and airplanes coming in and out of here at thousands a day, bringing stuff in, and whatever flu got from there, carrying it out with them and spreading it all over the world. So that's where flus come from. And you see how Wuhan, where they think coronavirus came from, is right outside the Guangdong province. And I'll bet you it followed that path, here to there to here to all over the damn world. If you want to know where coronavirus came from, probably happened just like that. And remember, I've been teaching this class this exact same way for 14 years. So this is not nothing new. We know that that's where the superflu is going to come from Hong Kong. All right. Why do all the flus come from the Guangdong province of China? For the reason that you can't keep ducks in your yard, waterfowl. All flus come from water birds, ducks and geese. And what do you have a lot of in the Guangdong province of China? People, farm animals, trying to do my little pig, and waterfowl, birds, ducks, and geese. These three in combination is the recipe for the flu. Having people, pigs, and waterfowl all in the same place. That's what causes flu. And where is it coming from? The Guangdong province of China. It's a largely rural environment with a lot of wetlands and people there to manage. So that's where flus come from. And the super flu will kill us all. Now in this picture, because it originates in waterfowl, remember, same DNA, it can infect chickens and so on. So the super flu, other candidates were the bird flu and the swine flu. And by the way, where did Spanish flu come from? It came from Puerto Rico. And it was Teddy Roosevelt and the Rough Riders and San Juan Hill and da-da-da-da-da. They came back to the United States. They all settled at Fort Riley, Kansas. and the the Spanish flu broke out from Fort Riley, Kansas, and it spread all over the world. Right. So other flus over the years, the bird flu. I was glad when this came out because the media started scaring everybody. Had people releasing their parakeets and shit. Why was I glad? This lady sold us a cockatoo, or excuse me, she gave us a cockatoo. Not a cockatiel, you know, the little white one, the cockatoo, the big one that has the vocabulary of a 2-year-old. Yeah, just gave it to us. That's at least a $5,000 bird. And it said she was assured she was gonna get the bird flu, so she gave us a cockatoo. So anyway, that bird was mean to y'all. But anyway, that is bird flu. The other one was swine flu. Were both candidates, but turned out not to be the super flu. Now, this is what kind of reinforces what I was saying a little bit earlier, that humans will not get a flu directly from a bird like that. They should have used a goose, but okay. They can't get a flu directly from a bird like that. The DNA, you know what? That's why I should have just got rid of these things in the first place. I was being lazy when I made this. All these little title boxes back here. I should have just got rid of them in the first place. All right. So how do people then get infected by something that shouldn't infect them because the DNA doesn't match? Okay, here's your culprit right there. The pig. You see, a pig can carry both bird flu and human flu at the same time. But remember, since this pig's DNA is different from both, the pig won't be sick. They'll have bird flu inside, they'll have human flu inside. The two can merge inside the pig and come out as a flu that will now infect both people and birds. So the flu hybrid or mutates inside the pig without making the pig sick. So when they were talking about bird flu and they were saying we need to kill all the birds, no, we need to kill all the pigs. That's where the stuff is coming from. So remember we talked about our ancestors being just as smart and they weren't stupid. You know, the Bible and the Quran both refer to the pig as a filthy beast. And you should not partake. And that's why, you know, so many cultures are against pork. It could be just that the pig was cloven hoof, had 2 hooves instead of 3 or 1, like a horse. And the devil's supposed to be cloven hoof. So they think the pig is the like the dog of the devil, the devil's dog or whatever. So, but it could be that they knew about its relationship between water birds, humans, and pigs. You get all 3 in the same location, and that's the recipe for the super flu. All right, so that's the flu virus and how dangerous that thing is projected to be for us. Now, these in this list, even if you heard of them, you might not know how dangerous they are. They've been listed as 1, 2, 3, and 4, saying which one of these are the most lethal viruses out there. And these are hemorrhagic viruses, meaning that once they get inside you, they liquefy your internal organs. And by the time you die, they cut you open, just look like a bunch of jelly in there. No liver and stomach, just a bunch of bushy whatever in there. The organs are usually not recognizable. And the lethality amongst here is Ebola is actually number 4. It's the least lethal thing on this list. Yellow fever is number 3. And that's based on the lethality. 60% of people who get Ebola are expected to die. and 75% of people who get yellow fever are expected to die. The other two are tied. The Marburg virus and the Lassa virus will both kill 97% of people who get it, regardless of what we try to do about it. Now that 93% or 97% is important because I just saw a movie on Netflix the other day. I didn't watch the movie, but I saw the title and I know exactly what they mean. 3% is the name of the movie. What does 3% represent? 3% represents the idea that no matter how lethal a virus, 3% of the population will be immune to it. So you see what's happening? This Marburg and Lassa will kill everybody that doesn't have a natural immunity to it. In other words, no viruses will be more than 97% lethal because 3% of the population will always be immune to whatever the virus is. Not the same people to the same virus, but 3% of our population. So when we say that a virus is 97% lethal, that's a pretty significant number. That means it's going to kill everybody except people who are naturally immune to it. And yes, there are 3% of people in the world who cannot catch the HIV virus. Or if it gets in their body, it won't make them ill. And so on. And same with COVID-19. 3% of us are immune to it. And that might be the survivors. All right. So the Marburg, the Lassa virus, Ebola, yellow fever, we still have to get that stuff into a laboratory and see if we can stop it in some way. And that's what these people do. The BSL laboratories. That's where they're doing COVID-19 research and that type of stuff. Now, in the world, drug manufacturers and other people are allowed to have up to BSL-3 laboratories. But BSL-4 has to be run by the government. So in the United States, there are only 2 BSL-4 laboratories. One is in Atlanta, Georgia, and it belongs to the CDC. The other one is in USAMRIID in Virginia, and that belongs to the United States Army. United States Army's medical research into infectious diseases. There's the BSL-4 is located in Virginia. Why the Army getting involved in this? Because we send military people all over the world. And the Army has to be at the forefront of infectious diseases. Those people we're sending to Afghanistan can come back with spider bites that infect their entire freaking family when they come home. So the Army is deep into BSL-4 research. It's not to make a war or a weapon out of it. It's to protect us from these people that we send out into all these different places like that we do. And then the other one is located in Atlanta, Georgia. So I'm gonna ask you, with stuff like Lassa virus, Marburg virus, up here in this laboratory, could you work there? Could you? Man, if you could. Could you work in that place? Knowing the type of stuff they have in there? You know what? I could, if, because understand these people making about $150,000, $200,000 a year. So they're making money. And I could probably work in there if I was by myself. I trust me. I don't know that I trust you. What happens if your silly ass cuts my suit by accident? Now, how many of y'all, if that happened to you, would turn around and cut their suit? I know I would. Are you shit? Did you just? Oh, hell no. Now what? It sounds bad, but I know a doctor or knew a doctor who contracted HIV from a needle stick on the ward, and she wasn't doing the procedure. She was just standing there talking to another doctor. And some idiot behind her turned around with an exposed needle and stuck her in her elbow. And she contracted HIV. And that was back in the day when HIV killed you in 7 years. That was back in the 1980s. And I will tell y'all how I met her tomorrow when we talk about HIV and the bloodborne pathogens and stuff. All right, so yeah, I could work in there by myself. I don't trust other people. We got too many idiots walking around there going, oh, I don't have to wear a mask because I'm young. Or, oh, I don't have to wear gloves because I can do it without getting blood all over the place. And what I said, if you're not going to protect yourself, how in the hell can I expect you to protect me? You can't tell me you care more about me than you do for yourself. All right, so those are viruses and some ins and outs about that. You notice there weren't a lot of questions in there, except viruses grow best in a cold environment. The next microorganism we're going to talk about is called a fungus. You want some of that? Anybody? Y'all want some of this stuff right here? In case you can't see the picture real well. Y'all want some of that? Eyes gone, nose gone, breathing through this little hole back there. And you know where this person got this? I don't know for sure. It's just a picture that I downloaded. But I would bet my paycheck, this guy went swimming in the wrong water and picked up some aspergillosis. Very fast moving fungus, gets in through your nose. And by the time they get it under control, all the tissue that it's infected, they have to take it out. So he got up through their nose into their sinuses, and they had to pick out all that tissue. Went swimming in the wrong water. I bet my paycheck. So that's a fungus. They tend to spread best in warm, moist environments. So we're going to see a lot of fungus in those places where it's just always wet, like tropical islands. And that's what this guy probably went on vacation, y'all. Went down to Fiji, the Bahamas or something, and jumped in the wrong water. And now you know why. You ever watch a swim meet? And those people wear those clips on their nose? They say, wow, man, they can't swim without getting, yeah, they can. Why do they wear those clips on their nose? So that crap doesn't get up their nose, whatever's in that water. And I promise you, the certain person that has the clips on their nose probably has earplugs in as well. Keep it from getting in their ears. If they think this much about it, then they probably go the next step as well. And that is important because of a condition known as meningitis. Meningitis happens a lot after swim meets or at summer camps where there's a lake where the kids are swimming. We often see outbreaks of meningitis in those areas. So something got up the guy's nose. You ever heard about when you watch the news every now and then from Galveston, you hear these warnings, don't go swimming in the water because the water's too warm. Fungus, bacteria is in that water. All right, so that is fungi. The plural for fungus, and then plural is fungi. Or you just say, I'm the fun guy. That's me. Who's the fun guy, Mr. Mahone? Hey, all right. So anyway, that's fungus. Protozoans, also called amoebas. You might have saw some of these in the drinking water in your last science class back in junior high. They took some drinking water, put it on a microscope slide, put it on the microscope, and you could see the amoeba moving around in Not really a problem for us until you go someplace where they don't filter the water. And as a result, they tell you, don't drink the water here. And you go, okay. And then you show up in my emergency room with gut-wrenching abdominal cramps, all bent over. Oh, I'm so sick. And then I'll say something like, you drank the water, didn't you? No, I did not swear. Nah, you drank the water. You got dysentery. No, I swear I didn't drink the water. All right, slick. Did you go to the club last night? Yeah, I went to the club. Did you have ice in your drinks? Oh, yeah, dumbass. Yeah, we tell you don't drink the water, don't have ice in your drinks either. That's kind of dumb. But anyway, hey, the good news for you is that if you get dysentery outside the United States, they're going to treat you with smokable opium. Yeah, take you down to a little room, give you the opium pipe, and you smoke it just like you did, just like they did in the old West opium dens, because it soothes the abdominal cramping. It doesn't destroy the bacteria or the amoeba inside you, but it soothes the abdominal cramping right away. You'll be out of pain on your first hit. Ooh, and your pain goes away. And then we treat the amoeba with medications. If that is the wrong type of amoeba, that just gets up in your brain, forget about it. You're done. The human brain doesn't look like this. They get it wrong in movies all the time. The brain is not red, it's gray. Because there's no blood flow into the brain. And as a result, the brain is gray in color. This redness, this is what killed the person. They got amoebas in there, or whatever they got in there. And this obviously was a post-mortem picture, so you know it killed the person. So that's amoebas. They get in usually through our nose and ears, through our mouth sometimes, and they lead to the state of dysentery. And some of them get into your brain and kill you. The next type of microorganism is called a helminth. And that's in red because a high miss question on the test is, what's another name for parasite? There it is, helminth. Another name for parasite. Now, parasites that get in humans typically come in the form of worms. Hookworms, pinworms, tapeworms. But fortunately, we don't get heartworms like dogs do. But one that is commonly mistaken is that is not a parasite. It's a ringworm. That's a fungus. They call it that because it's a red patch that's raised on the edges, and the edge looks white. So somebody said it looked like a worm laying in a circle, but it's actually caused by a fungus. So ringworm is not a parasite like the others, hookworms, tapeworms, and so on. How many of y'all used to sing that song when you was a kid? Ring around the rosy, a pocket full of posies. Ashes, ashes, we all fall down. How morbid is that shit? Ring around the rosy. These people had rosy patches growing on their skin with a ring around it. Ring around the rosy. This is about an infection. A pocket full of posies. They carried flowers in their pockets. So when they walked past the dead bodies all stacked up, they could take the flowers out and put them over their nose and mouth. So the smell of the dead bodies wouldn't be so overwhelming. Ring around the rosy, a pocket full of posies. Ashes, ashes. They were burning all the bodies. We all fall down. Everybody was dying. That song's about the bubonic plague. And another one, London Bridge is Falling Down. That's the song the kids sung when they hid underground while the Nazis bombed London. London Bridge is falling down. Yeah, they're under attack. There's some pretty morbid songs y'all sung as kids, man. I don't know what's wrong with y'all. We used to sing Miss Mary Mac, 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 all dressed in black, black, black. Yeah, uh-huh. Mm-hmm. Anyway, I don't know what that's about. That's probably about a damn child serial killer or some shit. And by the way, y'all should read the original Grimm's fairy tales. They cleaned them up. Yeah, Grimm's fairy tales were very grim. As a matter of fact, Hansel and Gretel did not get away. Yeah, the witch ate their asses. So y'all should read some of the original stories because they are not meant for children. I'm sorry. They were fairy tales. Fairies were not little fairies like Fern Gully or whatever. Fairies were evil, just like genies. Genies and fairies were not kid stuff. They were evil, both of them. So anyway, every time I think about ringworm, I think about Ring Around the Rosie. All right, so anyway, that's a helminth, also called a parasite. No, the two names are the same. The last of our microorganisms are called prions. These are the latest, newest things. These were came to light in the 1980s because there was an infection that was getting into people, and it wasn't caused by any of the other microorganisms that we know about. And that brought us a new category of prions. This is an example of what they probably look like. A couple of proteins with attachment points, the attachment points being yellow. And then the proteins, da, da, da. So a couple combined proteins with attachment points. But we know they lead to conditions of bovine spongiform encephalitis, or mad cow's disease, and Crutchfield-Jacobs syndrome. Both, we believe, are caused by prions. We can't detect these in the human body, and we really don't know what they really look like. This is what they probably look like. All right. Mad cow's disease. You ever seen a bunch of cows in a field? You ever seen one attacking and killing the other ones? It's mad cow's disease. They're literally attacking the other cows. And it gets into brain tissue. We don't get it because we don't eat cow brains. But in Europe in the 1980s, in some packing house somewhere, the cow brains came in contact with the part of the cow that they did eat. And as a result, some people contracted mad cow's disease. So if you were in Europe in the 1980s, they won't let us draw blood or donate blood in the United States anymore because we can't detect it in their blood or not. I was in Europe in the 80s, so I can't donate blood anymore. All right, and then Crutchfield-Jacobs syndrome, really, really severe disease. It's going to cause, more than anything else, it's going to cause problems in your newborns if you have prions in your body. All right, so that is the last of the microorganisms called prions. And there's your total list right there. Bacterias, viruses, fungi, protozoans, parasites, and prions. And we talked a little bit about each. Now, what's the best way to protect yourself from any of those? There you go. And this is the highest missed question on your test. Hand washing is the #1 way to prevent the spread of infection. I don't know if people just think too deeply into it. But the question is simply, what's the #1 way to prevent the spread of infection? And prior to us going virtual, they were all writing questions. And you'd be surprised some of the stuff I'd see on that line as the #1 way to prevent the spread of infection. It is hand washing. Now, did I say hand sanitizer? Tell y'all something. Hand sanitizer, that's for them out there in the world. For us, healthcare professionals, we wash our damn hands. The only place for hand sanitizer in a hospital or clinic is in a room where there's no sink. In which case, I'm going to ask you, what are you doing procedures in a room where there's no sink? Now, does everybody know this? Nope. What have I seen out there in the world? I went into the emergency room, the PCT. I'm laying up in the little cubicle in the ER, and there's a hand sanitizer dispenser mounted on the wall, and there's a sink right there, both in the same room. So who doesn't know this yet? The people out there, the people who you're going to be working with. And I looked at my wife and I said, when this person comes in to do my vital signs, which one do you think they're going to use? Are they going to use the sink, or are they going to use the hand sanitizer? What do you think he did? The PCT. Hand sanitizer. Now, I know some of y'all have seen the commercials on TV about washing your hands. And they're telling little kids 20 seconds. For us, 30 seconds times 2. You wash your hands with soap and water. You rinse. You wash again with soap and water. You sing the happy birthday song or the AV song, whatever it takes. But you wash your hands twice for 30 seconds. Now, have you ever seen somebody use hand sanitizer? Did they take off their rings? Did they take off their watch, their bracelets? Did they pull their sleeves up and wash from their wrist down to their fingertips for 30 seconds? No. They use hand sanitizer like they're a damn blackjack dealer out there somewhere. You ever seen the blackjack dealers? When they are when they're leaving and another person is coming in, that little thing they do. That's how people use hand sanitizer. I try to see how fast they get the shit done.
Can I interrupt you for one quick second?
Sure.
Did you get my email about Canvas? Are you good and comfortable with your course?
Yeah, I just need to know how to get into the big blue button thing. I've been in there, but the codes that we're going to be using. So we don't have to pay for it.
You don't have to have a code.
Yeah. Oh, you don't?
All you got to do is just make sure that all this, if you got,
Excuse me, y'all, just a second.
I'm sorry, I didn't mean.
No,
to
that's
cut you
okay.
off.
No, but all right. So, you ever seen somebody use a hand sanitizer? It's like they're going for a world record. How fast can I get this shit done? And I don't want that mess. I saw a girl come out the bathroom at the Burger King, and right there by the door, headed back to the food prep part, there was a hand sanitizer thing. She walked out of the bathroom, she walked up to the hand sanitizer thing, and right in there to fix my food. Now, what are the odds that she washed her hands in that bathroom? 0. Because I don't believe that she would have washed her hands in the bathroom and then came out and used hand sanitizer. She would have done both. I don't think so. She didn't wash her hands. She walked right over the hand. And she's ready to fix your food now. Guys, that hand sanitizer stuff. One day I walked into our lab, and right there on the sink was a bottle of hand sanitizer. I lost my cool. Oh, damn mind, you better walk your lazy ass over here and wash your hands. What the hell are you doing with hand sanitizer sitting right here on the sink? That don't make any damn sense. But people out there don't know. And you're going to suffer for it. So anyway, don't fall in for anybody's bullshit out there. The best way to protect ourselves and our clients is washing our hands. Okay, bacterias. Bacteria are spread through direct and indirect contact. They live on surfaces, so you touch that surface, the bacteria gets on you. You open your door, somebody else comes along and opens the door behind you, that's indirect contact. So if the bacteria, let's say the bacteria is on the doorknob, and you open the door and get the bacteria on you, and then you shake somebody else's hand, that's indirect contact. They didn't come in contact with the doorknob, but they got it as you passed it to them. So that's how we are infecting our patients, through indirect contact. We are touching somebody and doing their vital signs and walking right over to another person. And whatever we got on our hands, under our nails, underneath our ring, underneath our watch or our bracelet, we're now putting onto this other patient. Indirect contact. We are the source of moving it between people. So that's how bacteria are spread. Viruses, we already mentioned, airborne, control the airflow, use our barriers. Bloodborne, use our barriers. Food and waterborne, process and cook our foods properly, and then sexually transmitted, again, using our barriers. Remember, a barrier is anything that comes between you or protects that thing from getting into you or on you. I don't know if y'all have ever seen this thing before. The female condom. Hey. This thing slips into the vaginal canal. It's kind of like a reverse condom. You either put the condom on the male or you put the condom inside the female. Either way, it's a barrier that protects things from getting in through that opening. The people who make this thing actually said, and I saw the little advertisement for these things, that you can put this in before you go out at night. Now, what kind of hoochie you got to be to put this in place before you go out? Because you just know you're going to get busy tonight. That's just crazy, y'all. Imagine the man putting a condom on before he leaves the house and gets there with you and has got lint balls all on it. That's just the definition of hoochieism right there. Put it in before you go out. You just know you're going to get busy. All right, so anyway, I'm going to ask y'all a question. First, I'll tell you something. There is no law that says that a person who has HIV has to disclose their HIV status to you as a healthcare worker. So let's say you're a phlebotomist and a patient comes in to have their blood drawn. They don't have to say anything to you if they're HIV positive. Do you think there should be a law that requires them to? What you think? You can nod, you can shake. What do you think? Should there be a law that requires them to divulge their HIV status to you before you draw their blood?
I don't think there should be, because you should already, as a healthcare professional, be that cautious.
Bingo. That's the statement right there in your slides. To treat all persons and body fluids as if they are infectious. In other words, you don't have to tell me you're HIV positive, because I'm going to treat you that way anyway. We treat everybody as if they're HIV positive. That way, they don't have to disclose their personal information to you. You don't have a right to know their HIV status. They have a right to privacy. And the only people in healthcare that they have to divulge their status to is somebody who has access to their medical records anyway. Their doctor or their surgeon. You don't have access to their medical records. You don't have access to their information, and you don't need it. All you're doing is drawing their blood. So even if my mama sits down in front of me, I'm going to draw her blood the same way I do everybody else's. Treat all persons and body fluids as if they are infectious. It protects us, and it also preserves their right to privacy. and that is universal standards, also known as universal precautions. The new school term is standard. For me, old school, I learned precautions, so I might use that word occasionally. But the term today is universal standards, and that is to treat all persons and body fluids as if they are infectious, using universal standards. So as you see, all that's in red. It'll be on your test. Okay, so what I'm going to do now is I'm going to go on into class now. We still have a few more slides in this one, and then we'll get into bloodborne pathogens tomorrow as well. Anybody who wants to get a jump start on your reading can be reading chapter 1 and 2. Those will be the first chapters we'll be doing in the textbook. So you can start looking at that homework and how that works. This evening, I'm pretty sure I'll remember, I'm going to go on and send out the, as a matter of fact, I'll do it right now. I'm gonna send you all the list of the homework pages. So just like last module, anybody who wants to get a good jump on it can do so. You can go and get started on that homework now. So we need to go to 727. Let's not make the same mistake I made this morning. And 817. Homework pages. And attach that from the cloud. Ooh, there you are right there. This is HP 102 homework. And then anyone can view. All right. So that's the list of homework pages. You can go on and get started on that. If you're really not understanding what it is, then just hold off and we'll do a little go over some of the questions so you'll know exactly what it is they're asking for in each section. So if there's a section that you don't feel comfortable with or you don't know what they're asking, hold off on that section and we'll cover each one of the sections in class. Okay? So that is today's class. That class will continue tomorrow morning at 8 o'clock. We'll continue in infection control and then proceed on into bloodborne pathogens. Take a look at that syllabus if you get a chance tonight, and it'll tell you kind of how we're going to proceed. So any questions before we log off for the day?
Yes, I have a question.
Yes.
So I heard that you record the like today's class?
Yep.
Okay. Is there any way I can get that recording?
I'll send it out. Won't be right away because it usually, once I've stopped the recording, usually takes about an hour to convert the recording. So I won't be able to send it out right at the end of class, no, but I'll send it out, yes. And when you do,
only because I missed it.
If you do want to view that recording of today's class, you're gonna have to download it to your device. If you try to watch it just through the email, just clicking on it, it'll work, but it's gonna be real like sketchy, like skipping and popping and all that because it's coming from the cloud. So download it to your device if you really want to see a recap of today's class.
Yeah, if you could send it to me, please, I'd appreciate that.
No problem, I'll send it to everybody. Any other questions? All right, I'll see y'all tomorrow morning. I just did. Oh, well, I didn't send it yet.
Yeah, I didn't receive it.
Duh, gotta click send. Anyway, be telling y'all, make sure you use an email right. But anyway, so it is sent now, and y'all get to that. Any other questions? All right, I'll see y'all tomorrow.
Oh, sorry. Tell the new people how you want them to send the homework because they don't know.
Yeah, we'll talk about it tomorrow. You don't have any homework that needs to be sent in to me for quite a while, so don't worry about sending it, but you can get started on doing it. And if you were in the orientation last week, I did show you that, but I'll show everybody because not everybody was in the orientation last week. So I will go over that over the next couple days. Anything else? All right, we'll see y'all tomorrow morning at 8 o'clock.
All right, what happened to your big setup you had?
I'm not going to keep bringing it.